صدق الله مالك الجلال والإكرام العظيم. صدق الله العظيم. Jazakallah. Thank you very much, all of you. I am very happy that our head and supervisor, Dr. Ajaz Rashid Saab, made this possible. I am very glad and I am very thankful to all of you. Before I started, Sir Dr. Jaz, if you can make my ID from laptop, I joined. Can you make myself the co-host? I am raising hand. Where is my hand? Yes, here. And please, Dr. Humaira Khan, please raise your hand as well.
Okay, I make it. Okay, Dr. Miraj, go ahead.
Now, sir, make me the co-host.
Yeah, I make you co-host.
Okay, sir. Dr. Humaira Khan, are you the co-host? Okay, got it.
Assalamu alaikum, I guess so. Yes, I am. Thank you.
Thank you, ma'am. Just I am sharing my screen. This is an organization. Actually, the person who is in command of this organization is Dr. Ajaz Rashid Saab. Is our most respectful person. Actually, this is the organization is a dynamic global organization, and it is connecting the world and empowering nations and serving humanity for a sustainable earth. You can see here about this organization. Actually, basically just we are focusing on education at global level. We have officers and representatives of over 65 countries here, including Canada, USA, England, and other European countries as well. Our target is to bring the experts from different fields of education and from over 170 plus countries. Here is our Sir Dr. Noble General, Dr. Jas. After that, Dr. Humaira Khan is in second in command. After that, and this you can see here all the different. I'm just scrolling in a fast speed, so we have not a lot of time here to because this is a lot of widespread. You can say that it's a huge organization. Okay, so just our focus this time is to make free education, and after that to you can say that implement all the at global level the sustainable development goals of the United Nations for a sustainable earth. We have representatives from all over the world, as I told you that over 65 countries, and just we are growing. This organization is established in 2023, and after that, as I am working since 2019 for youth of Pakistan, after a lot of achievements, so I decided with my mentors, especially Dr. Jaz Saab, that we should proceed from a specific platform. So he gave me this gift with the blessing of Allah Almighty as well. And a lot of persons we have here from England and USA as well. We have our different professors from the Pakistani universities and from other different universities from England as well, and from Netherlands as well, and Afghanistan as well. We have a lot of persons here as a representative of Nepal, India, Afghanistan, and Nigeria as well, Kenya. a lot of countries we have persons from there. Even Saudi Arabia, we have different important personalities. So I think that I have done with my this introduction a little bit. Okay. So from here, I am very thankful to you, all of you, that you came here and Sir Ajaz Saab made this possible. As I am a veterinarian, so I decided to add my work in this field as well. As I am working in other fields, so I decided that I have to work in the veterinary sciences as I am from this field. Thank you very much, all of you. Thanks a lot. Dr. Maira Pahnwar, please start from here and please invite another person to continue this conference. Thank you very much. Thanks a lot.
Thank you so much, Dr. Mohammad Miraj Saleem. We are honored to have you with us today. Next, we have a special welcome message from Professor Dr. Aneela Durani. So first, I will introduce Professor Dr. Aneela Zamir Durani. Dr. Aneela, Ma'am Aneela is a distinguished academic leader and veterinary medicine expert, serving as a tenured professor and dean of the Faculty of Veterinary Science. She oversees the Office of the Dean 24/7 extension services and student affairs, while also mentoring students as the principal officer. Professor Dr. Aneela Durani has supervised over 70 MPhil students and 90 PhD scholars and has published an impressive 140 research papers in impact factor journals. She is also the patron of Core Students Club and the principal investigator of the Civic Engagement Program at the University of Veterinary and Animal Science, Lahore, demonstrating her commitment to education, research, and community service. Please, ma'am, come and say welcome message.
Madam, ma'am, are you here?
Dr. Rashid, can you kindly unmute her? She's asking to get unmuted.
I make her co-host.
Maybe she is facing some problem. Can you do it manually for her, please?
Let me see.
Ma'am, please, actually, the problem is that when a person, you can say that leave this meeting due to any issue in the connectivity of the internet, so just he will be removed from the co-host as per the recommendations of Zoom app. Yes, sir. So we have to make her the co-host again.
Assalamu alaikum. Bismillahirrahmanirrahim. Are you able to hear me?
Yes.
Miraj?
Yes, ma'am, we are.
I would like to welcome you all to the International Veterinary Conference organized by MGEU and Vet Crescent Club of UVAS. And I think this is the year gathering of veterinary professionals. I am thrilled to have you join with us, and I hope this will be an unforgettable experience of learning, networking, and collaboration. Our conference promises to inspire, educate, and connect you with the like-minded individuals who share your passion for animal care and welfare. The important aspects of today's presentation are presentation from the experts, interactive session, research and innovations in the field of veterinary education. Networking opportunities are also there. Therefore, our goal is to provide platform for knowledge sharing, professional growth, and we believe that together we can make a meaningful impact on the lives of animals and veterinary community. Thank you so much for being part of this exciting event. And I am really very thankful to Professor Dr. Ajaz Rashid, who is very helpful for the students and the faculty and veterinary institutions in Pakistan for their uplift. Thank you so much, sir. And I warmly welcome our Vice Chancellor, Professor Dr. Rana Muhammad Younus, in this conference as well, and all the participants from other institutions, including UVAS and GOMAL. I have seen many students from other areas and other out of Pakistan as well. Therefore, welcome all of you, and I wish you have a good learning experience. Thank you so much.
Thank you so much, ma'am, for the inspiring words. So I now invite our esteemed chief guest, Professor Dr. Muhammad Younus, Vice Chancellor of UVAS, Lahore, Pakistan, for the opening ceremony and a brief overview of conference. So first I will introduce Professor Dr. Younus. So Professor Dr. Muhammad Younus, Vice Chancellor of UVAS, his PhD from United States of America, postdoctorate from University of Minnesota, USA, and doctorate in pathology and public health from University of Minnesota, USA, University of Veterinary and Animal Sciences, Lahore, Pakistan. Won at least 6 academic merit scholarships, Star Award 2009 by South Asian Publications, Excellence Award 2013, 14, 15, 16, 17, and 18 by PVMC and PVMA. Research Productivity Award 2013, 14, and 15 by PCST, Government of Pakistan. Best University Teacher Award 2014 by Hague, Islamabad. Distinguished Leadership Award International 2016 by University of Minnesota, USA. Sir, please come and join.
First of all, good evening to everyone participating in this international conference. I am highly grateful and thankful to Dr. Ajaz Rashid, who has arranged such a wonderful event at international level. He has collected the veterinarians all over the world for this international conference. And I am very grateful and thankful to his team and colleagues also who helped him to organize such a wonderful event all over the world. This is a unique opportunity for participating all the veterinarians in this conference who will definitely share the ideas and learn something from the experiences of other people. I am very optimistic and hopeful that the participant will learn the knowledge, techniques, and skills regarding veterinary sciences from this international conference, and they may be will be able to implement these practices and experiences in their respective departments, hospitals, and institutions, and we may be able to train the manpower more and more for the uplift of veterinary sciences, for the uplift of veterinarians all over the world, and we will be able to uplift the economy of the profession and veterinarians all over the world. I am very grateful and thankful to Dr. Ajaz Rashid and his team once again for arranging such a wonderful international conference for the veterinarians, which will play a key role for uplift the and strengthen the veterinary sciences all over the world. Thank you very much. Thank you.
Thank you so much, Professor Dr. Muhammad Younus, for providing valuable insights into the conference significance. I now invite our head of the conference, Dr. Ajaz Rashid, Chief Secretary General of MGEU and CEO, East Windsor Animal Hospital, NJ, USA, for conference introduction and rules and regulations.
Assalamu alaikum to everyone. Please accept my regard to everyone who listening in the conference, and special, I very thankful to Professor Dr. Rana Sir, the VC UVAS, our chief guest, who join our conference to give encourage and also strength to the veterinarian students to present in this conference. I hope everyone have a wonderful time. First of all, I thank you everyone who make this conference successful. Dr. Miraj, and his team, and also the Vet Crescent, and also coordinator Dr. Rashid Chaudhary, Iqbalian veterinarian, and all other organize, who make this conference very successful. I'm sorry, I have some infection going in my throat. If you have any inconvenience today, I'm sorry for that. Other thing that about this conference, our only one objective is that to give a knowledge, experience to our homeland veterinarian who practicing, or students, to give up-to-date knowledge about the latest technology. And also about this conference, we make a certain rules. Each speaker has a 15-minute. Each speaker has a 15-minute, and after 15 minutes, I have a stopwatch, and there will be beep. And after beep, please, you guys wrap up your subject within 1 minute. With 1 minute after that, you have, with your presentation, please ask 2 questions from the student, and student need to answer the question. And first of all, before they answer, they need to name your name and university name. So Dr. Miraj will write down the student who gave the correct answer. In this conference, the previous conference, we have a negative mark also. But in this conference, we don't make any negative mark. So please raise your hand freely. I appreciate this opportunity is for the student, okay? Student will raise your hand, give your name and your university name. At the end, we will let you know which university have more point or which student has give more point. And after 2 questions, I will ask 1 question regarding board prepare NAVLE exam, because a lot of students, they request that we need to prepare of the NAVLE exam for the USA board exam. I give them some idea how the exam is coming, how the question is coming. Please, it's my request for all the speakers and the student and audience, please pay attention with the presentation. We have wonderful speakers. Dr. Professor Mazhar Iqbal is one of the best surgeon in the Pakistan and is well known. And we also have Professor Dr. Akram is very well known in poultry field and microbiology field. We have Dr. M. Shah Saab, who have very good experience, is very good knowledgeable. He has very whole in veterinary medicine in USA. He has a very good experience. You will love his presentation. We also have Professor Dr. Aneela Durani, who have very good command. He also giving a subject, which I suggest the subject, lymphosarcoma of the cattle, which is very common disease in USA. And few question is definitely coming in the exam also. So please pay attention. We have other speaker, Dr. Humaira, very good presentation on the FIP, very good subject. We have Dr. Rizwan, we have Dr. Farid, who have very good subject on the falcon endoscopy, how you want to perform the disease. We have Dr. Rizwan, we have Dr. Amir also. They have very good experience in the wildlife, and hope you guys have a wonderful time. Plus, my presentation is also with you guys. I want to present a very good case, a real surgical case. We have a limited time, but I will wrap up all that subject also. So please pay attention. At the end of the conference, if you have any question, speaker, if you have any question regarding any speech and speaker, please put on the chat room. We can answer all the speaker at the end of the conference, because we don't have a time right now. At the end of the conference, whoever they have the answer, the speaker will answer that question. Another thing that, please be positive. Whoever raise your hand, please be patient. We give you time, and everyone has answered the question. We have plenty of time. We are not in rush, but we give the time to all the speakers equal time. Every speaker has a 15 minutes. If anybody has any confusion, please let me know. Thank you, and have a wonderful time, and hope you have very good time. Over to Dr. Maira.
Thank you so much, sir, for your insightful words. So here our presentations start. Our first speaker, Professor Dr. Mazhar Iqbal, a renowned international animal scientist and surgeon. He has great experience in medicine and surgery. He worked as senior surgeon in different countries. His invention and methods in veterinary surgery are amazing and appreciable. He did an amazing job in veterinary research as well. He is the most senior veterinary expert of this conference as well. Professor Dr. Iqbal will be presenting on real surgical case studies. Please join me in welcoming him.
I think I make the co-host Dr. Mazhar Iqbal, sir.
Yes, sir, for sure. Let me see again.
Let him make him co-host again, okay?
He is co-host, Dr. Ajaz. He is. Maybe he is.
Sir, can you hear me?
Yes. Yes, sir.
No,
Dr.
I'm
Humaira, you are right.
Professor Mazhar Iqbal, sir. I don't know, we have two, like one is like a Dr. Please, sir, can you raise your hand? I think I make you co-host. That's a Mazhar Iqbal. I don't know.
So I'm trying to call him. Just give me a minute.
Sure, ma'am. Can we start with another person, with another speaker, if possible, sir, Dr. Jas?
Let me.
Our second speaker is Sir Ajaz.
Okay.
Dr. Ajaz, I just talked to him. He's coming online from another computer. The other one had a technical glitch. He will take just like 2 minutes.
So let me start my presentation then, okay?
Yes, that's good too. Thank you, sir. Go ahead.
Assalamu alaikum to everyone. So today my presentation is
ये उन्होंने कर रहे हैं ना ऐसे कुछ कर रहे हैं हाँ वो कहना मैं अच्छा
Dr.
okay.
Ajaz, yes, Dr. Mazhar Iqbal will be presenting now because he already,
Okay.
I think, made a request. Thank you
Okay,
so much,
let
sir.
me stop my
Thank
sharing.
Thank
Okay,
you,
go ahead.
Thank you, sir.
मेरा कर दे
Okay, Dr. Mazhar sir. Professor.
okay okay everyone can you hear me
Yes, sir. Yes, sir.
okay assalamu alaikum everyone today I have two cases which are quite very interesting cases which we attempted here. The reason of presenting these cases is to just give more emphasis on the importance of pre-operative workup, the laboratory work, and pre-evaluation of the patient, so that we can formulate the best treatment for our patients and to satisfy the owner as well. The first case is a unusual case of a thoracic foreign body in a cat. This case, actually, Okay, now this case, it was a 10-year-old, long hair, female Persian cat. It was weighing about 3 kilograms. And it had a history of, complaint of vomiting with occasional sneezing last 2 days. It was referred to the Round Lake Animal Hospital, DHA Phase 6, Lahore, Pakistan. Now, in this hospital, I am also, on their panel as a consultant surgeon. Actually, this is one of, this is an internationally owned hospital, which has all the facilities, diagnostic, therapeutic, treatment, surgical, etc., for small animals, large animals, for birds even, under one roof. So, well, that was just the introduction that where I am working also. So when the cat came to us, we just took the routine radiographs for our normal workup of the abdomen and the thoracic cavity, because the cat was sneezing as well as the cat was vomiting. So in the thoracic cavity, we saw a sewing needle, which was actually an accidental finding. Now the attending veterinarian at that time, because I was not there at that time, because I go there only on calls. So assuming that the needle may be still in the esophagus, he performed gastrotomy and tried to remove the needle from through the gastroesophageal junction, but he could not find it. So then they called me, and a day after, we again took the radiographs of the thoracic cavity and the abdomen, just to evaluate the abdominal details and to see the exact location of the needle, in the thoracic cavity, so that we can decide our surgical plan, that how we can help that poor cat. So the needle was clearly seen in the dorsal third of the thoracic cavity, but the abdominal radiographs, they were unremarkable. You can see on this picture, you can see in the dorsal third of the thoracic cavity, the needle, I am just showing it with the help of the arrow on the lateral radiograph. And on the VD radiographs, you can see the needle just, lying just, opposite to the spine, or the vertebral column. So then what we did is, the other clinical parameters of the cat, such as the temperature, respiration, CRT, hemoglobin, PCV, they were within normal range, but there was slight leukocytosis, which is understandable. Then, our surgical plan was, on the basis of those radiographs, I decided to perform median sternotomy for removal of that needle. So what we did, the cat was anesthetized, of course, with isoflurane, oxygen inhalation anesthesia, controlled in the dorsal recumbent position. The skin and subcutaneous tissues, they were elevated, from the midline out of the sternum. Pectoral muscles, they were incised and they were elevated from the sternibry. So then we partially split the sternum in the middle with the oscillating saw, and then we completed the incision with the osteotome and the hammer by, very careful striking. But we saved, or we spared, the manubrium and the xiphoid cartilage, or the xiphoid, so that, during closure of the sternotomy incision, we don't feel any problem. So that the anterior cranial end and the caudal end of the sternum, they were intact. Only the sternibry, they were, open, the middle. So we saw the needle, lying, in the dorsal third of the thoracic cavity against the vertebral column. So it was, that needle, because it was clearly seen there, we just picked it up with the, the forceps, in the jaws of the peen forceps. It was taken out along with the thread, Thread was also there so I don't know how, actually, the needle had passed from the esophagus directly into the thoracic cavity instead of going into the stomach. But luckily, the needle did not, injure any of the thoracic organs. Otherwise, the cat might have, died beforehand. This was the needle which was removed from the thoracic cavity, and you can see the needle along with the threading. This is the post-op X-ray of the same cat. you can see the clear thoracic cavity. Then the sternormine CN, it was closed with the simple interrupted, we used proline USP1 because I didn't want to use the absorbable suture material because it takes a long time to heal. It was sternibri, and so I used the proline. And on a strong curved needle, it was a reverse cutting needle, very strong, so that it could go through partial thickness of the sternum. It went very easily because the cat was only 8 months old, it was young. Then the pectoral muscles, the sternormine CN, that was closed routinely with the polyglycolic acid. Skin in CN, horizontal matter sutures, where everybody knows that how to close that. So this is, after 2 weeks, the same cat. You can see where the incision it has healed, and we have removed the sutures. And the same cat sitting very happily in the hospital. And then she was discharged after about 1 week after she was discharged, and the cat was happy, the owner was also happy. The other fracture case I want to present is the tibial fracture in the Rottweiler. The reason for presenting this case is that is, how we have to evaluate the animal according on the basis of sometimes the weight of the animal, size of the animal, the temperament of the animal, hyperactivity of the animal, how it is docile or it is very hyperactive. And this is a case which will tell us that, we must think 100 times, before attempting or before deciding any treatment for the fractures. So it was also an 8-month-old hyperactive Rottweiler, suffered from short oblique fracture of the proximal third of the tibia. Yeah, you can see it over here. It's a short oblique fracture, tibia and fibula both are broken. On the left side, you can see very easily the type of the fracture. Actually, it was, by, a veterinarian via private practice. It was immobilized with intramedullary pain and full cerclage wires. But however, the fracture collapsed 2 days after the surgery because the dog was very hyperactive. So it could not really, bear the stress, the pain and the cerclage wires, they could not bear the stress of the activity of the animal. The pain bent under the weight of the animal, and it was again brought back. You can see on the right side, on the left side, it's just immediately post-operative with the, cerclage wire, which is, I don't know how it has been applied, but there is a pin inside. But on the left side, you can see the pin has bent and the fracture has collapsed. So then it was, it was brought to our hospital in the Veterinary College. We reoperated it. The pin, because it was, bent at the fracture site, it was very difficult to remove it. So, with difficulty, we cut the pin with the pin cutter, where it was bent at the fracture site, and we removed both the ends of the pins, with the help of the, pin remover. Then, because it was a short oblique fracture, so we did the interfragmental compression first with a 4.5 mm cortical screw, which was used in the lag effect. Everybody knows how to use it in lag effect. Then we applied a 6-hole DCP on the medial side of the, cortex of the bone as a neutralizing plate. Because, of course, it was a DCP, but we used it as a neutralizing because the fracture was already, fixed with the interfragmental compression, screw. So we could not, compress it anymore. So this is, you can see the lag screw, which is shown by the arrow, and we could use only 2 screws in the proximal fragment and 3 screws in the distal fragment. And, this dog, also it was okay. This is the other view. On the lateral view, you can see the lag screw and the plate. And the dog was extremely hyperactive. So he was, confined in a cage for at least, for about 4 weeks. But however, the dog started bearing weight, 2 weeks after, after the surgery, and was almost full weight bearing 6 weeks post-op. The fracture healed uneventfully, without any major complications. This is the dog. You can see it is standing very happily, on all the four legs. And I also had a video for it. I couldn't upload it, and the dog was also bearing weight on the hind limbs. So the reason for presenting these two cases is that we must think beforehand what to do and how to do, and so that the animal is happy, our patients are happy, and our clients are happy. Thank you very much. So if you are, I can ask two questions as Dr. Ajaz Rashid has, suggested us.
Yes, sir. Thank you.
Yes. Okay. So my first question is that why, isoflurane anesthesia, gas anesthesia is necessary for thoracotomy. If we want to open up the thoracic cavity, why should we use only the isoflurane or the gas anesthesia? Anybody,
Can you unmute the?
we can unmute the, audience.
Yeah, okay. Go ahead, answer that.
Hello, hello, sir. Am I audible?
Yes.
Yes.
Sir, answer is that I think isoflurane is easy to maintain during surgery. That's why we use isoflurane
No. I
during
am
surgery.
particularly talking about
As
the
compared
thoracic
to
cavity, because we cannot use any, intravenous injectable anesthesia to open the thoracic cavity. We have to use the gas anesthesia. What's the reason behind that? It may be isoflurane or any other anesthetic agent, but we have to use the gas anesthesia.
Sir, we actually got an answer in the chat from a young doctor named Salman Zafar. He
Yes.
says that to prevent the collapse of lungs because thoracic pressure can go when we open the thoracic cavity.
Yes. Negative pressure, it will, it will evolve. Yeah, very good. Amar, the second question is, because I have told in the lecture also that we have to see many things before we try to fix a fracture. That we have to see the site of the fracture, type of the fracture. We have to see the adequacy or of the reduction, adequacy of the fixation, temperament of the animal, age of the animal, weight of the animal, and disease condition of the, before we decide for the treatment. So will anybody tell me only 4 factors which will affect the fracture's healing? Only 4 factors which affect the fracture healing. Out of many factors, only tell me 4.
Miraj, are you there?
Yeah, but I have elaborated them just now. So you have to tell me out of many factors which can affect the fracture healing, just tell me 4 factors which are very important.
Can somebody unmute the people who raised the hand?
sir, those factors can we tell about after post-operative, like post-operative treatment, like steroid drugs, the dexamethasone or some others, also reduce healing, and vitamin K deficiency maybe.
No, I have just told you, 7 or 8 factors which will affect the fracture healing. So out of these, only you can tell me 4 of them. Yes. Yes, please, anybody? Or should I repeat?
No, somebody.
Basically, which the social factor include yani, movement of the animal and hyperactivity of the animal and
Shabbat,
any
very
medicinal
good.
to
Yes,
treat
yes,
for
it's okay. Yeah, the type of the fracture, site of the fracture,
and
accuracy of
nutrition
reduction.
we provided during post-operative care. Social factor means movement of the animal, activity of the animal, and medicinal
Yeah,
medication we during
yeah,
post-operative care. And most importantly, type of the fracture. If it is as a joint fracture, a few months on site.
yeah, yeah.
Uh,
Okay, okay. Yes, that's good. That's good. That's good. Okay.
Please say your name and also university name also. Sir, can you stop your sharing your screen so next speaker will?
Okay.
Dr. Ajaz, can you make Dr. Miraj the co-host again because he got disconnected and came back again? I think he raised his hands.
Uh, Dr. Miraj, are you here?
Yes, sir. Now I can.
Okay. Please, Dr. Miraj, can you note the student's name and university name also? Whoever answered the question, okay? Please,
Yes, sir. I just note down the name of the previous person. Just I am finding out the Umar Farouk. Just he just gave the answer 1 minute before.
Okay, let me start my presentation. Does everyone hear me?
Yes, we do. Kindly continue, sir.
Okay. So today my presentation is about the hemo-abdominal, like a blood in the abdominal cavity. It's a very broad subject. It's very broad subject. Okay, I cannot discuss like all the causes of the hemo-abdominal. There are so many causes. Sometimes the accident happened. You can see the blood in the cavity. Sometimes there may be tumor, mass growth. There will be the blood in cavity. Sometimes we see the bleeding disorder, DIC, also cause the hemo-abdominal infectious disease, parasite also. But today, I like to discuss only one reason. That's most common we see in practical life. There's a spleen tumor. The blood in the abdominal cavity, when the spleen tumor rupture, you can see the blood. At that time, you make a decision, critical decision. Do you want to save the animal or what you want to do? You want to euthanize the animal? What is the prognosis? These are the most important factors which I like to discuss today. As we have a time limit also, so we will discuss only very briefly and very shortcut because we have everyone has a 50-minute and also might put like a timer here. So I like to go like a very brief, discuss only one case. This is a very interesting case. Is a Cloud, a 13-year-old male mixed breed dog that presenting to ER. ER mean like emergency hospital. They're 24-hour hospital. They open and they go there. These are my client. They go because our hospital is closed. And this happened in the night time. The dog is panting a lot, shaking a lot. And the owner has a concern what's going on because they did not eat the food also. They go there emergency hospital to find out what's going on. After waiting 7 hours, they find the dog has a spleen tumor. These are the emergency hospital North Star. There are their record. And these are the client name Cloud, 13-year-old male dog. There's a page owner name 15. Is almost very old dog. So these are the emergency hospital note. If you can read I put there how we working in the USA. These are the notes from the emergency hospital, what they see, what are they report making the. So if you look the presenting complaint, the cloud was presented to ER for evaluation of panting and shaking starting last night, Sunday night, and throughout Monday. Seemed not be himself. He ate 9 p.m. and for last night, 5 a.m. not interested in eating. Rest is clinical signs okay, fine. I don't want to go like in detail. I just want to see what they see. They did like a very small, fast abdominal ultrasound. They see like a moderate abdominal fusion, like a blood, large left side cranial to mid abdominal mass. If you look my the first slide, I put his picture also. This one is a big spleen tumor on the abdominal cavity. So after discuss with the ER, they give like a 3 option. Either they want to do the surgery, but they charge like a lot of money, like a $12,000 with the scan. And also they want to send home. This is my favorite medicine, the Chinese medicine, Yuhana, is very good medicine to stop the bleeding. That's my one of the favorite medicine when we use. I don't know what the Chinese people put inside, but believe me, this medicine work amazing in cancer patients, especially to stop the bleeding. So they gave like 3 options. Either they want to give this medicine sent home, or third one, they can put down, they can euthanize the patient. The owner declined. They say, we want to take to our patient to our regular vet. They have to do the surgery. We are very confident our vet, they can do this surgery and they can save his life. They call me, they text me in the morning that Cloud has this problem, this and this thing going on. I say, no problem, bring back, we will do the surgery, no problem. So these are all about the emergency hospital, what they did. The blood work still look okay, fine, not bad. And these are the authorization, whatever. When they came in our hospital, we open his belly, we see a lot of blood in the abdominal cavity. This is my favorite gun, like for the blood vessel sealer. So my assistant is ready for the suction for the blood, okay. We just remove the falciform ligament. I just want to go like very fast because we have very time limit. It's a big tumor on the spleen. You can see there are multiple tumors on the spleen. The spleen was ruptured from here. All the blood is coming. My target is that to complete this surgery, to remove the spleen within like 7 to 10 minutes, which we did. We use like a blood vessel sealer. I have very latest blood vessel sealer. You seal the vessel very well. I'm just going like very fast. We just remove the spleen, and the fun part start after that we're removing the spleen. We see a lot of blood in the abdominal cavity. We remove all the blood, almost like a 1600 cc blood. And after that, when I make sure that I remove all the blood, everything from the abdominal cavity, this is after like 1 hour. After the surgery, the patient feeling much comfortable. After 1.5 hours, feeling very good. And after 2 hours, we try to feed and start eating food okay. Because patient is not feeling any pain, anything. The way we perform the surgery is very painless. We use like latest blood vessel sealer. we also use like a surgical laser to open his belly. So does not feel any pain, anything when he wake up. It does not have any pain, nothing. The next day, we check the blood work to see like how much blood the patient lost. Of course, we see like anemia, we see like total volume blood is lost, but still it's not like a less than 21%. So we did not do any blood transfusion, anything. And we know that when he start eating food, it will be, hopefully it will recover. So these are the blood work. Unfortunately, the report came back after 1 week. The patient has hemangiosarcoma, which is one of the nasty tumor with a very aggressive tumor and one of the very common tumor we see on the spleen. The survival time, this all about the hemangiosarcoma, the survival time is very less, like even after surgery is 1 to 3 months. And with the surgery, with the chemotherapy is only 5 to 7 months. But the client, they are so happy that they have some couple of months. So they are very happy. They very thankful to to me and my hospital. We send over the couple of medicine also. These are the favorite medicine, which I told you guys. This is a Chinese medicine. It worked amazingly, to be very honest. And after the client gave us a review also on the online, when he come in like a recheck, she bring like a gift for me and my staff also. They gave like a very good appreciation card. This is a client after like a 43 days.
Hey guys, this is Cloud. So on May 6th, Cloud is 13 years old. He's a mixed breed. He was panting and shaking terribly. And we took him to North Star at about 11:30 p.m. And we got there and we were told that it would be about a 2-hour minimum wait. Shh, Cloud. Cloud was in obvious pain and distress, and we were not seen until 7 a.m. in the morning, 7 hours later. The vet took him in the back, and he had blood in his abdomen and a mass on his spleen. Excuse us. We were offered 3 options: euthanize Cloud, take him home, and put him on Unibio. Cloud, come here. Do surgery to remove his spleen. That would cost us well over $12,000 with imaging. I am fortunate to have an amazing vet, I really am, who has performed 2 other complicated surgeries on my 2 other dogs. So I texted Dr. Rashid at 8 a.m. before the office was even open. And he told me to bring him into the office and he would do the surgery for me that day. For literally a fraction of the cost. Cloud's been a patient of his for many, many years, and Dr. Rashid really, really, really cares about his patients. It was a very difficult surgery, and Dr. Rashid had a very difficult time controlling the bleeding, and no one really thought that he would make it through the surgery. Well, he did. The first 10 days were difficult for him, and we were very worried. Shh, Cloud. But he has gotten better every day. Unfortunately, the biopsy came back as hemangiosarcoma, and we were certainly devastated. Today is 43 days post splenectomy, and Cloud is doing amazing. He's happy, he's healthy, and he's playing just like before. We know that he doesn't have much time, but we're giving him the necessary supplements to keep him comfortable. He's really showing no signs of any bleeds at this point. So we are hopeful, and we just can't say enough things about all the wonderful experiences that we've had with Dr. Rashid and Cloud. And we're so thankful for every day we have with Cloud. Thank you.
So what's the average lifespan of dog with suffering with the hemangiosarcoma tumor after surgery without chemotherapy? I still have 4 minutes in my. Miraj, can you unmute the people who raised the hand?
Sir, less than 3 months.
Yeah, that's right. 1 to 3 months. Between 1 to 3 months, they have a lifespan. And this is my other board.
Ahmad, can you please tell me from where you belong? Means what's your name of your university?
Tanveer Ahmed from Islamia University, Bahawalpur.
Sure. Thank you.
Please, can you scan this question and raise your hand if anybody knows?
Sir, can you hear me?
Yeah, we hear you. Who's this?
Now, in this question, would give high volume loads in the cardiogenic shock.
Who's this? What is your name?
Dr. Mohammad Farani, sir, from UVAS Narwal 2023 batch.
UVAS Narwal. So why you say the cardiogenic shock?
Now, in the cardiogenic shock, the heart is already suffering and it is not sufficiently pumping the volume of the blood. In the cardiogenic shock, the volume is normal, but it is the heart that is defective. If you
Yeah.
give load in this condition, it will worsen the case.
Okay, that's good. Very good. Very good.
And sir, I got a question also regarding the hemangiosarcoma.
Okay,
Can we
let's
can we
over
give
to the
blood transfusion?
co-host. Okay, Dr. Mar.
Sir, I got a question regarding hemangiosarcoma. Can we export
Dr.
blood transfusion?
Dr. Fran, can you give me one favor? Can you write down the question in the chat room? We can answer at the end of the conference. Okay.
Sure, sir. Sure.
Thank you.
Thank you so much, Dr. Ajaz Rashid, for that enlightening presentation. So our third speaker is Professor Dr. Akram Munir. Professor Dr. Akram Munir is a distinguished microbiologist and academic leader, serving as Professor of Microbiology and Chairman of the Department of Pathobiology at RIU, RCVETS Lahore. He holds a PhD from the University of Minnesota. Dr. Akram Munir also completed a postdoctoral fellowship in microbiology at the University of Minnesota and is a fellow of the Food and Agriculture Organization of the United Nations. He is a member of a prestigious scientific societies, including Sigma Xi USA and the Society of the Phi Zeta USA, demonstrating his commitment to excellence in scientific research and education. Dr. Akram Munir will be discuss poultry and how to make poultry business profitable. Please join me in welcoming him.
Yes, we get Akram. Sir, please start from I just shared your presentation here.
Yeah, can you hear me?
Yes, we hear you.
Okay. Today we will be talking about an industry which is very dear to all of us, especially whenever we take our breakfast. We need eggs. We need cheaper proteins of poultry. So I will discuss about the fundamentals of profitable poultry farming in Pakistan. Most of the references I will be quoting will be about the Pakistan. So I must thank my granddaughter Fatma bint Mazhar. She typed all this presentation for me. Next, please. Yes. So let us review some of the poultry production systems in Pakistan. Poultry basically is divided and is formed in various capacities in all over country. It is divided into backyard poultry, then rural poultry, and then very recently we have semi-commercial poultry, like a person raising around 200 birds, and some of the eggs will be consumed, some will be sold. Then commercial, and they house millions of a bird at a farm. Then the rearing systems are in our country are still there are some open sheds, environment control, automated systems. These are around now 60% of the total poultry farms. The rearing systems basically, as are advancing with the advancement in knowledge and technology. So rearing system are most important than in the environment. Open shed environment is basically no more required for the poultry. Whereas the environment control systems, they have ventilation control, they have drinking, temperature, space, and then gases formation controls. There, another very important area is that the farming has now become integrated. An organization will have its own feed mill, its own poultry breeding farm, its own hatchery, multiplier farms, processing unit, value addition systems, and marketing systems. Very good marketing system. And we should remember that whosoever is getting excellence in poultry production, they have a very good marketing system. Around 25% of their expenses are marketing systems. Poultry let us remember that in Pakistan, now poultry contributes around 50% of the meat available to common man Pakistan populations. So this is a very important industry. What are the various factors which are important in determining the poultry farming? First is the chick price. You have seen in the last few weeks the price was even up to 200 rupees per chick, day-old chick. Then the feed price have which has reduced during these days. And then the vaccination. We have a whole bunch of diseases against vaccinations are done. Then medication, sometimes in our country, the farmers grow for the self-medication of their flocks. Then the labor, their wages. Then we have to pay the housing rent, and the farm rent. And then the market price of finished product. This is very important. Of the broilers, of the eggs, and then most of in our farmers, especially those having birds in the open shed system, they are at the mercy of weather. If it is hot, they are in trouble. If it is cold, even then they are in trouble. Next, please. Okay. Then there are many other factors. What is the overall cost of production? There is one very good system of evaluating it, European efficiency factor. How much you put in the money and how much you earn, and that is measured in figures. Higher the figure, higher the profit. Then another factor is very high mortality in the open sheds and also in the control sheds. Morbidity, culling. Mortality, you remember in case of avian influenza, there is very high mortality. I have seen even 80% mortality due to H5N1 in Lahore. Morbidity, the number of birds affected. Most of the diseases, infectious diseases, almost 100% of the population is infected. Then the rate of culling also determines the profit. If the birds are uneven, if they are unhealthy, if they're not gaining weight, then they have to be cut. So if this number increases, profitability is lowered. Then we have to see uniformity. Uniformity is important from housing till the market. If the birds are of the same size, they eat same kind of food, and they live in the same environment, they should be uniform in their weight and their look. But this uniformity has to be worked out in the forms. Back, please, back. Please go back. Okay. Then farm gate price. What is the price at the farm? If the chicken is being sold at 600 per kg in Pakistan, farm rate is too much less, maybe 500 per kg. Then the market outlets, where you sell your finished food. Sale volume. If you have a lesser number of poultry, and then you have definitely less profit. Flock size. If you have a good flock size, like maybe 5,000 chicks, you will have more profit if they come up with good FCR and good price. Then we have to see the marketing strategies. These have to be worked out really before marketing the chicks or eggs. Next, please. Okay, profit versus loss. Poultry could be profitable if we adhere to the basic life-saving principles. That is the growth, selection, feeding, health, timely housing, marketing, economic considerations. And any deviation from such principles will always lead to the losses. Next, please. Next. Hello. Hello.
Ji, sir.
I cannot see anything.
We can see your slide.
No, mine is lost.
Sir, just I shared the next one.
Yeah, but you can have the next one, but let me see it. I cannot see anything.
Okay. Do you have anyone in nearby yourself, any person who can see your mobile and just scroll aside?
Let me see. Let me see. Okay, I think I got it back. Thank you very much. Now
Thank you,
let
sir.
us
Thank you.
see the key factors that determine profitable farming. Farm location is very important. It should be accessible by road. It should not be in that down area. It should be at some upper area. Farm should be prepared for before arrival of chicks. We should have vermin control, wildlife control, biosecurity, better cleaning, disinfection, good brooding temperature, low density, drinking water supply, potable water, good feed, good litter, good light, ventilation, etc. Now, if we have to house the chicks, we should know that the chicks we are getting are from a reputed hatchery, and they have been obtained from a breeder flock which have the genetic potential, performing well under the local conditions. It should perform well under the local conditions. Check for any ailments like respiratory distress, paste advance, heating signs. Overheating sometimes in the incubators, there is overheating of the progeny. Then there should be body of the chick should be properly developed. And we should also check the weight of the chicks on arrival. Remember, if we start with the low weight chicks, we will always have low weight of the finished project. Avoid transport stress. Provide disinfected litter. Check the brooding temperature, which should be ranging from 95 to 96 in the beginning. Sometimes it is even up to 97 degrees Fahrenheit. But remember to reduce it every week till you come up at a temperature of 75 degrees around 4 to 6 weeks. Next, please. Next. Okay. Brooding is very important, and this is basically determines your profit. We need to check for proper water supply, and most of the time we are using the nipple drinkers. Check for feeding of the chicks. Is every chick going to the feed? Check for any digestive problems. Is there any respiratory problem? Physical ailments, injuries, wounds, etc. And most of the time, what we check is the navel. If there is any problem with the navel of the chick. Check for any gas formation in the brooding house. This is very important. When there is a gas, chickens do come up with the respiratory troubles. There are many gases like ammonia, H2S, carbon monoxide, carbon dioxide. And we should also monitor the availability of drinking water feed for all the chicks. Sometimes the number of drinkers or feeder is low and the number of chicks is more. Let us start working on the uniformity of the chicks right from the second week. Make sure vaccines are administered as per recommendation of the manufacturers under the guidance of a veterinarian, and these vaccines are monitored for their efficacy. The main vaccine recommended, which are recommended during the first week in Pakistan, are in Newcastle disease, infectious bronchitis, avian influenza, in some areas still hydropericardium syndrome, infectious bursal disease, fowl cholera, and there are many which I will name later. Next, please.
Next, Dr. Aneela.
Next, please.
Mute karo, Raj.
Next, please.
Next slide, Miraj.
Yeah.
On it, sir.
Yeah. Look for any deformity, digestive problem, respiratory, lower the temperature by at least 1 to 2 degrees Fahrenheit every first week. They detect to determine uniform weight gains. Make sure the availability of recommended water and feed regimens. Decrease the density of chicks in the second week. In the third week, give vaccination against infectious bursal disease. Very important. Newcastle disease, infectious bronchitis disease, and avian influenza vaccine, they have to be given in the first week. And monitor the vaccine for antibody formation in the serum of the birds. Decrease the temperature to 84 to 85 degrees.
Sorry to interrupt you, sir. Your time is over. Just wrap up like within 1 minute.
Okay. So basically, I just wanted to say that there are many factors which determine the profitability, but we need to implement all the scientific recommendation for that good profit gaining from your flocks. Thank you.
Thank you, sir. Thank you. No, you asked the question, okay, to student.
Okay, I have two questions. There is a term very importantly used, biosecurity, in the poultry farming. What is the meaning of biosecurity? Can anybody say? Yeah.
Miraj, can you unmute the?
I did, sir.
Yeah.
The people who raised the hand.
Assalamualaikum. Can you hear me?
Yes, sir.
So biosecurity basically refers to the measure and protocol designed to protect against the introduction and spread of harmful biological agents, infectious diseases, pests, rodents, etc.
Good. Thank you.
Hussain, your university name kindly.
Ma'am, Shivas Jang.
Thank you. And everybody, please follow these. Everybody has keep on telling you guys. So please follow the protocols. Thank you so much.
Okay, then the second question is, what do you mean by seroconversion? Amna Kamal, you have raised your hand.
Please, Amna, unmute yourself.
Yes. Seroconversion is a general term for the time between exposure of virus and when antibodies show up in the blood.
Yeah, it's basically the effect of the virus to the vaccinated.
Development of specific antibody in blood.
Yeah, Anna, I'm hearing you. You listen to me. It's basically the demonstration of quite good number of antibodies in the serum of the birds which have been vaccinated against any disease, virus, or agent. Your answer is also correct.
Thank you so much, sir.
Thank you very much, sir. Let me ask you
Amna, what's your university name?
Can you write it in the chat, please?
Agriculture, Faisalabad.
Sure, ma'am. Thank you.
Okay. If you guys scan this question and let me know who knows about this one, raise your hand. Miraj, can you unmute the?
Yes, I can, sir. Talha.
The first is Amna. Come.
Assalamualaikum, sir.
Dr. Please speak up.
Sir, Dr. Muhammad Usman Ahmad from UVAS Narowal.
Sure.
Sir, is hypothyroidism.
Why is hypothyroidism?
Sir, because if basically the problem is thyroxine is not appropriate produced, and due to which the body metabolism is not appropriate, and that's why this cause, like other causes, scabies, flea infestation. In this situation, the pruritus is the main thing.
Yeah, you're right. So all these things, like if you look like this is like a heart thyroid gland problem, and everything else like it has like some itching, or the feel like a very bad itching, slicking, all these things, okay. Only the hypothyroidism, they don't feel any itching or anything, but you see like a symmetrical alopecia. Sometimes you see the rat tail syndrome. The rat tail syndrome is also same thing like a hypothyroidism. Rat tail syndrome, if you look the rat, there's no hair on the tail. And if you see any case of dog, there's no hair on the tail. First thing, like to do this test, hypothyroidism. To diagnose the hypothyroidism is also very tricky. But if your lab is very good, they can do the test T4, free T4, and you can find the hypothyroidism. Thank you. Let's over to the Dr. Maira.
So thank you so much, Dr. Akram Munir, for the enlightening presentation. Our fourth speaker is Dr. Ahmed Said Shah. So Dr. Ahmed Said Shah is graduated from CVS 1982 100-year class graduation. He is a small animal practitioner in United States of America, director, Marriott Animal Hospital, United States of America. Director Glenn Animal Hospital, United States of America, will present on feline hyperthyroidism. Please join in welcoming. Dr. Ahmed Said Shah.
Thank you so much, Doctor. Good morning and Assalamu alaikum to everyone. I'm a practitioner and I'm going to talk a little bit differently. I will try my best to say something which you cannot find in the books. So that is the whole goal. As a clinician, we take a patient and we investigate, and then we try to find the diagnosis as soon as possible, and then we treat it. So my emphasis is how to diagnose hyperthyroidism in a cat as quickly as possible without doing any unnecessary tests, without wasting time, and how we can treat this cat successfully. So that will be the whole topic. So let's talk about the signalment first. As a clinician, what we see is mostly a problem of the older cat, but in my experience, I have seen as young as 4-year-old cat. There's no breed predisposition. You know, it can happen to short hair, medium hair, long hair. So any cat with the presenting sign of vomiting, weight loss, normal appetite, you know, and excitability, aggressiveness. So those are the most common signs we see it. Now, instead, you know, there is a very set rule for any clinician that you develop soaps. When, you know, you present with a complaint, then you do your exam, then you make a plan, then you treat. So it is really a great way to, you know, go through the case, and it is going to be helping, especially for the people who are interested to take NAVLE exam. That's the way it goes. So with the signalment, when we look at the vomiting or weight loss, obviously that can happen so many different things. Like if the cat has simple is the dental issues. Can I eat? Yes, that's pain can stress cause vomiting. That also can cause weight loss. If the cat is diabetic, can cause the same thing. If the cat has some kind of renal or, you know, liver issues, same thing. If the cat has a tumor, same thing. So there are so many things comes in the same scenario. So the first of all, what we do is we make a plan. So let's rule out a lot of other things. So we do the routine screening, which is very important. And that include blood work, that include an X-rays, because this is all about evidence-based medicine. You know, you have to first diagnose it before you start treating anything. So when you do X-rays, you're ruling out all the tumors, you're ruling out any kind of foreign body, you're ruling out any, you know, organ abnormality like atrophy and all those things. And when you're doing blood work, you're ruling out obviously lymphoma, you're ruling out kidney, liver, diabetes. So what kind of blood work we're looking at? We're looking at CBC, very plain and simple, complete blood count with some, you know, serum chemistry. But very important, we have to include in our blood work thyroxine, T4. Sometimes we also do free T4, we will talk about in a minute, but T4 quantity is the most important and will single test diagnose hyperthyroidism. So let's suppose we did the blood work, we did the X-rays, we couldn't find anything. I look at the cat's mouth and everything looks fine. The blood work come back with no anemia, no leukocytosis, renal values are normal, and then no liver enzyme elevation. The only thing we saw is T4 is high. So that is our diagnosis, hyperthyroidism. Now, let's talk about the hypothyroidism. What are other things which we are going to look for? So the hypothyroidism is a very complex scenario in a cat. It really caused by a couple of things. There is a tumor of the thyroid gland. It can be benign, it can be, carcinoma. Less than 2 or 3% cats, you're going to see an adenocarcinoma, but vast majority of the cats come with the adenoma. Adenoma is a benign tumor, and it can be treated successfully. If it's adenocarcinoma, bad news. There is no way this cat will survive for long. Yes, temporarily you can suppress the tumor, but it does not get under control, unfortunately. But that's the way you diagnose it. You do not do any biopsy. You do not do any aggressive, because thyroid glands are so tiny in the neck, and they are associated with the parathyroid glands. And if you surgically touch them, it's not a good successful outcome. So now we have a diagnosis. Now how are we going to treat it? So there are different ways of treating. Some cats who have a true hyperthyroidism, and some cat has, they do not have a hyperthyroidism, but they are going to have it maybe in later years. So those are called pre-hyperthyroid cats, and they get treated just by putting them on a special diet, which is called YD in Hill's diet. That's what the prescription diet is. But if the true thyroid cat, hyperthyroid cat, we treat it with 2 ways. One, a medication, methimazole. That's the only medicine available, and it controls it is a cytotoxic medication. It actually controls the rapidly growing thyroid cells. And other treatment is placing a radioisotope. Placing a radioisotope is also very, successful surgery, but it costs a lot of money, and it has some side effect. And typically, any clinician, it injects subcutaneous that injection, and then it suppresses the cells. It actually kills the cancer cells, and that's the way you control hyperthyroid. The only problem is the cat need to be quarantined, because through their urine they radiate. There's a lot of radiation, and it can be a human concern for the human contamination. So that's the only, and it's also pretty expensive. But the medication methimazole is really very convenient. It's being compounded orally. It can be given straight tablets. It can be given intradermal, actually subdermal. So those are the preparation. After the treatment, there is a problem with this medication, because this medicine does cause some side effects. What are those? Kidney issues, because kidney issues is very common with the treatment of methimazole. So what we do is we recommend blood test. Sometime we start with the monthly, and if it's well regulated, then we go every 3 months, then we go every 6 months, then yearly. Now, there's a couple of things which I wanted to, bring it out. One is, what is the hallmark of this disease? The hallmark of this disease is weight loss and vomiting, with a normal appetite, normal activity, and maybe a little bit of hyperacceptability. And what is the most common precaution we have to consider while treating this disease? That is possible side effect of this medication, which is methimazole. It has been, in my experience, I have treated so many cats with the good success. They can die with something else, but hyperthyroid can be treated very successfully. Unfortunately, it's not curable. because once the tumor cell is developed, whether it's benign or malignant, let's just keep going. And, as long as the cat has a good quality of life, I think that is all matters. Felines medicine is a little more complicated because medical therapy is not so easy. I have 2 cats in my home, and I'm telling you, giving medicine to a cat is a nightmare. But you just have to try it, and you have to use different means. So that's why a lot of people, they want a quick fix. They try not to give an oral medication, and unfortunately that is not available unless you use the radioisotope treatment, which is also very successful, but it's pretty costly. Usually cost is like $7,000 to $8,000 in my experience. So I think if we can just investigate this disease the way I just explained to you, I had a very good success, and I never seen any problem. And these are the way, if somebody is taking a Navali test or any question, these are the way they're going to be asking, what is the most common signalement, or what is the most common treatment? So I think I wrapped up my article. I have 2 questions I'm going to ask any student who want to answer that. That would be fine. Number 1 is, if the cat is presented to you for weight loss or vomiting, what is the first thing you want to do to diagnose it?
Assalamualaikum, sir. Can you hear me?
Yes.
Sir, if a cat presents to us with weight loss and other symptoms, then we first will do with the blood test, CBC, as you said.
CBC is not going to tell you anything.
Please say your name and university name, then you answer them.
Hussain Raza from UVAS.
So my question was, what is the first thing you want to do to diagnose hypothyroidism? And the answer was CBC. CBC is a complete blood count, and it will not tell you serum chemistry. You need thyroid test, T4. That is the most important blood test to diagnose hypothyroidism. So the second question I have is, if you start the medication, what is the most important thing you need to look at?
Sir, Tanveer Ahmed, possible जो इसका side effects हैं जो medication हम use कर रहे हैं उसका हम check कर सकते हैं.
What side effect we are talking?
Sir, side effects उसमें जो है cytotoxic reactions वगैरह आ सकते हैं, allergic reactions वगैरह.
Okay, no, allergic reaction, I haven't seen it, but let me just explain to you that 2 things we have to look for. One is renal values, because one of the
sir. Sir, may I say something according to this one? Sir, I am Mohammed Hassan Ali from Rifa. Sir, according to the this medication, the cat can it is also cytotoxic, and the cats can have allergy reactions. Specifically, the cat will start itching around his mouth and around his neck. There is a specific term for this one. I have forgot now. And also, yes, as you have explained, we should do the test for the kidney.
Kidney, and you have to keep an eye on T4 concentration, because
Yes.
sometimes if we're giving too much medicine, the cat can turn into hypothyroidism, and which is not too bad, but still, you do not want to give the medicine more than it need to.
Yes, sir. Yes, sir. Exactly. Yes, sir.
Thank you very much, Dr. Ahmed Saeed Shah Saab. Thank you very much for your presentation. Very nice presentation about the hyperthyroidism. When I was studying University of Missouri, Columbia, there's a board certified, double board certified doctor. She explained about the hyperthyroidism, beautiful way. She said, at this time setting, Shah Saab, she said, hyperthyroidism, the cat jumped. So always in the cat, the hyperthyroidism, the dog did not jump. So dog always has the hypothyroidism. And also with the hyperthyroidism, name with the hyperthyroidism, there's one common disease developed in the heart. It's called like a hypertrophic cardiomyopathy. That's also board question, Navy board question. Thank you very much, Shah Saab. This is a very important topic. And we see a lot of cases hyperthyroidism in USA. Okay. Is anybody know about this thing, this question? Today I make all very easy question. Last presentation I asked something very difficult, but today we make very easy.
The answer would be laryngeal paralysis.
How you know about this thing?
I recently passed NAVLI.
That's good. That's good. Yeah. That's very good. Okay. Fran, congratulations. Your Navy test and your answer is 100% true. Okay. Thank you. Let's go for the next. Over to Dr. Maira.
Thank you so much, Dr. Ahmed Saeed Shah and Dr. Ajaz Rashid Saab. So our fifth speaker is Professor Dr. Aneela Durani. Professor Dr. Aneela Durani presenting on lymphosarcoma in cattle. Please join me in welcoming him. So please unmute, ma'am.
Sir, please make the co-host. Actually, she just lost her connectivity with this meeting. So I believe that we have to make her again co-host.
Okay, I make the co-host again.
Okay.
Madam,
Ma'am, Dr. Aneela, for here, then please raise your hand. Then we will see you here.
No, I make the co-host again.
Okay, so let me open her presentation if you're. Yes.
Yeah. Madam,
Dr. Miraj, please unmute her manually if you can.
Okay,
Because she's
sure.
asking about it
Yeah, I
again.
am unmuted.
Okay, ma'am.
Thank you so much. Am I audible, please?
Yes.
Yeah, I can hear you, ma'am.
Thank you so much. Thanks a lot for having me and giving me this very important topic of lymphosarcoma in cattle. Lymphosarcoma is a blood-borne infection, and it is caused by a virus that survives in the WBCs. Next slide, please. So this infection is basically subclinical, always asymptomatic in 5% of cases, while in 10 to 20% of cases there is persistent lymphocytosis. Actually, persistently infected cattle are reservoir of this infection, and this lymphocytosis is not only present in bovine leukosis, but it is also present in other conditions. I'm not going to go into detail of all those infections, but mostly any viral or parasitic or bacterial infection can also lead to lymphocytosis, blood cancers, and autoimmune diseases, especially when they are going for the leading to the chronic swellings or irritations that also lead to lymphocytosis, and it can also be drug induced. So lymphocytosis is a pathogenesis that is present in bovine leukosis, and when it becomes chronic, it can lead to malignant tumors of lymphatic systems, and these tumors are present in uterus, abomasum, lymph nodes, spinal cords or spinal tract, and kidneys as well. So there are different classifications of this disease on the basis of number of lymphocytes affected, etc. So we can have a lot of literature on the different forms and classifications of the disease. Basically, it is caused by the virus that belongs to Delta viruses, and these viruses have structural homologies with the human T cell leukemias. And in this group of Delta viruses, the viruses share common ancestry and genomic organizations. The DNA intermediate as pro-viruses are produced by infected lymphocytes, and this then is added into the genome of the cells. Next slide. Now, as far as the prevalence is concerned, it was first described in Germany in 1871, and then cases were followed after World War II as well. In Pakistan, over 20% of seroprevalence was noticed, and it was 42% in Holstein Friesian and 28% in Jersey cattle, while in crossbred cattle it was 11%. The most important factor of this disease is its economic loss, because it leads to contamination of carcasses, it leads to the loss of value of animals. It can lead to restrictions on the semen import, and mostly in developed countries now, BLV negative replacement bulls are preferred. Therefore, if there are positive cases, they are discarded. Next slide, please. There are different forms of the disease. It could be aleukemic disease. It could be enzootic bovine leukosis with persistent lymphocytosis, or it could be enzootic bovine leukosis with tumors. That is most common in adults. It is also seen that the disease is mostly less prevalent in beef cattle, and there is no natural infection in other species that is reported. Next slide. Since it is a blood-borne disease, therefore blood and other body fluids that are infected with the blood cells are the source of infection from the infected to the uninfected animals. Mostly managemental strategy play an important role in the progression of and spread of the disease. If we talk about the direct contact, then it appears that the close physical contact has limited value unless the nasal and ocular secretions that are affected, that are infected with the infected blood, they can lead to spread of infection to other animals through mucous membrane. But otherwise, if we see managemental practices on a form like contaminated needles, obstetrical sleeves, or dehorning equipments, or tattooed pliers, or tags, and hoof knives and nose tangs, they are all source of infection to the other animals, especially to the calves. Insects also play a role, and they are suspected to be as mechanical vectors. Milk and colostrum has lymphocytes, but they are not the major contributors of the spread of infection. In utero, vertical transmission is there. If we talk about semen and embryo, if they are properly washed, then they are not the source of infection, but the embryos can be infected in the infected recipient. So there are cases where the calves are born with the infection from the uterus. So in utero infections are there. Interesting thing is that BLV positive healthy animals are not transmitting the disease unless they have infections like seminal vesiculatus and other reproductive diseases. Therefore, the transmission of this important disease should be considered as a bloodborne disease infection. Next slide, please. Now, BLV, if we see, it is transmitted between bovines via horizontal and vertical transmission. And since the virus is very much similar with the human T lymphocyte virus 1, therefore that disease is also transmitted via horizontal and vertical transmission. Pasteurized, unpasteurized milk and uncooked meat are the source of infection for human beings. And the most important thing is that for the efficient transmission of both BLV and the human T lymphocyte virus 1, it requires cell-associated infections. BLV was isolated from the breast tissues of the humans, therefore designing eradication plans and improving preventive strategies are mandatory when the link between BLV and the breast cancer is confirmed now. Next slide. Now, if we talk about the risk factors, hurriedly I will go through it. With the increasing age, the rate of infection is there. It is mostly seen after 24 months of age when the heifers join the milking herd and are in the close contact with the older cattle. Then the rate of spread may also be associated with the prevalence of infection. And when the prevalence is above 40 or 42, then the spread is much rapid. Genetic resistance is very important because once the infection has occurred, subsequent development of only one antibody response, with or without the persistent lymphocytosis is determined by the host genetic markers. And 1 to 5% of the BLV infected cattle seems to be under genetic control of the host. So genetic aspect is very important. Susceptibility of the other diseases is there, and in this disease, the immune system is impaired. Therefore, there are chances of other disease infections. Obviously, the introduction of infected animal into the herd has a significant positive effect on the prevalence of infection in the herd and the development of clinical disease in that is very much actually less. Then the calf management is important, and as I have told earlier, managemental practices are very important. At every point where the calf is brought in contact with the infective blood, that will increase the level of infection in the calves as well. Pathogen-related factors are always very important. BLV is highly cell-associated and persists in the subpopulation of peripheral B lymphocytes and to much lesser extent to subpopulation of T lymphocytes. Pre-virus is rarely or never found in the blood of infected cattle. Next slide. So having said that, the outcome of exposure to the cattle is either there is failure of animal to become infected, probably because of the genetic resistance, or there is establishment of a permanent infection and the development of detectable levels of antibodies without clinical or hematological abnormalities, and that is actually a leukemic infection. Or there is a possibility of establishment of permanent infection and the animal becomes seropositive and also develop persistent lymphocytosis. And the fourth possibility is that the animal become infected and seropositive animals that may or may not have been through a stage of persistent lymphocytosis and may develop neoplastic malignant tumors or lymphosarcomas. Next slide. So when the animal is infected, either there is infection or there is no infection because of genetic resistance. And when there is infection, there is either seroconversion or there is infection that persists in the animal becomes seropositive, but there is no lymphocytosis and no tumor formation. In case of seroconversion, there are again two possibilities. Either there is formation of lymphosarcomas, that is less than 5% cases, or there is persistent lymphocytosis that is seen in 29% of cases. Next slide. So after infection, within 2 to 12 weeks, among other factors like depending upon the risk factors actually, and depending upon the infective viral dose, infection and seroconversion is seen. antibodies against BLV are not protective against tumors development. Whether or not the animal become infected or develop any of the forms of the disease, it depends upon the recipient's genetic constitutions, animal immune system, and size of infective dose. Lymphosarcomas usually occurs in BLV infected cattle 5 to 8 years of age. So lymphosarcomas is a disease of adult cattle. Next slide. The incubation period of the disease is 4 to 5 years. And in 5 to 10% of clinical cases, the course is peracute and the affected animal often dies suddenly and unexpected without any prior evidence of illness, involvement of adrenal gland, or abomasal ulcers or acute internal hemorrhages are seen. The animals are often in good body conditions. In most cases, the course is subacute up to 7 days or in chronic form several months. Next disease. Next slide, please. So the main clinical signs are in high rise in temperature, enlargement of superficial lymph nodes, and cardiac signs are very important because of the pathogenesis in the right atrial wall, causing right-sided congestive heart failure. There is hydropericardium and hydrothorax with the related signs. I am not going to go into detail of those signs. Digestive tract lesions are also there with the persistent diarrhea that is unlike with the jaundice disease, and there is also occasional melena. Nervous signs include knuckling and of the hind legs with the one leg may be affected or the other legs may also be affected. It is followed by difficulty in rising and finally by clinical recumbency and inability to stand. Sensation is also restrained and sensation is initially retained, but later it is limited or absent. The less common signs include enlargement of different lymph nodes. There could be protrusion of eyeballs. There could be involvement of uterus or kidneys. And so rectal palpation is very important in this disease for diagnosis in these conditions. Next slide. So this slide shows different gross lesions of bovine leukosis. It is the slide of 4-year-old Boston Friesian cow. And you can observe severe enlargement of mesenteric lymph nodes in picture A, perigastric, inguinal, mediastinal lymph nodes. There are pictures of different organs, including vertebrae, and they show in the last picture of that is designated as H, there is severe hepatomegaly due to intrahepatic proliferation of the tumors. So tumors are very important factors when you go for postmortem or necropsy. This is the picture that you mostly find in the internal organs. Next slide. Histopathological characteristics of exotic bovine leukosis, and it is again in the 4-year-old Boston Friesian cow. There is accumulation of neoplastic lymphocytes within the myocardium, that is A, lungs B, and uterine wall C. Neoplastic proliferation of lymphocyte is separated by the fibrous connective tissue that is attached to the thoracic vertebra, that is in the slides D. Next slide. So serological tests include ELISA, AGIT. AGIT is specific but not very sensitive diagnostic test as compared to ELISA. We also go for a radioimmunoassay that is suitable for individual cows testing, but because it is very accurate as compared to other tests, it is the most sensitive test that is useful for the detection of BLV antibodies in cattle exposed no longer than 2 weeks of age, 2 weeks of infection in milk samples and in serum samples. Then we can go for a PCR as well, that is sensitive and specific assay, as you know, and it can detect BLV infection in peripheral blood lymphocytes. The test is useful for early detection of BLV even before antibodies are present. Next slide. Now, this slide shows the differential diagnosis of from various diseases like tuberculosis, jaundice disease, traumatic pericarditis, spinal cord abscesses, down form of rabies, fat necrosis, and actinobacillosis. So since it is a multi-systemic disease, we need to go for differential differential diagnosis of those diseases that are affecting different organs, systems in the body, including digestive tract, nervous system, and even respiratory system as well. Next slide. There is no treatment. Next slide. So the prevention is either we can go for a possibility of vaccines, but the research has shown that different types of innovations or tools were used for the control of this disease. But as far as vaccines are concerned, inactivated vaccines, cell-derived vaccines, subunit vaccines, or recombinant vaccines, all these were used, but there's not much success. The only thing that we can do at the form level is to stop the transmission of these viruses by adopting good form practices. Next slide.
Madam, sorry to interrupt you. Your time is over. Please, can you wrap up in 1 minute?
Yeah.
Thank
Yeah,
you.
sure. So we can go for prevention of entry of infection or biosecurity measures, control of insects, blood transfusion, and vaccines containing blood, such as those used for babesiosis and anaplasmosis, are particularly potent means of spreading the disease. So they should be avoided, or they should be checked. Then a selection of cattle with inherent resistance is the main thing that we can go for long-term control of this disease. Thank you so much.
Madam, can you ask the question to the student?
Yeah, my first question is that what is a leukemic, what do you mean by a leukemic infection?
Please, can you guys raise your hand?
Can I have the answer, or should I go for the second question?
Please, ma'am, repeat the question again.
Okay, I repeat my question. What do you mean by a leukemic? What do you mean by a leukemic infection? Can you explain that? With a particular reference to bovine leukocytes or lymphosarcomas.
Anyone, please raise your hand, okay? Look like, madam, your question is very tough, okay?
Okay, I changed my question. I changed my question. My second question is that on what factors does the, or we can say that what are the host related factors that are important in the control of the disease if we are going for the control measures? What are the host related factor most important? That is one only. What is the host related factor that is important for the control of?
Sir, आवाज आ रही?
Yes, yes.
Yeah.
Basically, जो horizontal भी इसकी ट्रांसमिशन है, vertical भी इसको स्टॉप करने के लिए जो हमारी ट्रांसमिशन है बेस का, उसको हमने स्टॉप करना होगा सर.
Yeah, but what is the factor?
From on to the other animals, ma'am. Basically, we were discussing in your presentation. Mainly the equipment, transmissions, or biosecurity. Okay.
Basically, it is the genetic resistance and immune system of the host that are important if we are we want to control the disease.
Okay, okay, ma'am.
Yeah. So I have asked two questions. Should I go for a third one?
Yes, yes, go ahead. Go ahead, ma'am.
Okay. My third question is that what or you can say that is a BLV a zoonotic disease?
Yes, nautic.
So how can you say that it is a zoonotic disease?
Ma'am, by consuming milk of infected animals, either male or female, it can lead to breast cancer, and then it can also transfer to baby.
Okay, half of your answer is right because it is a zoonotic, it is considered to be a zoonotic disease because anti-BLV antibodies were isolated from the breast tissues. So, but still we need to work on its detection in the human cases. Since it's very closely related with human T lymphocytes virus 1, therefore we need to look into that. So partially your answer is right.
Okay, thank you, ma'am. Thank you very much.
Thank you, sir.
Very easy question. Okay, if anybody knows. If anybody knows, raise your hand. Okay.
Assalamu alaikum, sir. Sir, Dr. Muhammad Usman Amanat, UVAS Narwal. Sir, it's Pasteurella multisite.
Yes, very good. Yes, very good. You also see this is very common in the rabbit. Rabbit, we see this a lot of problem with the Pasteurella multisita, especially with the allergic rhinitis, and is also very common in the cat. Yeah, you are right. You're fine. Let's go for the next speaker. And
thank you so much, ma'am, for wonderful presentation. So our sixth speaker is Dr. Humaira Ahmed Khan, CEO of Vet Lagari Animal Hospital, Lahore. She completed her MPhil in Vet Internal Medicine on fully funded Turkish scholarship. She has been cultural ambassador for Pakistan in USA. She has been cultural ambassador for Pakistan in USA, former veterinary practitioner in Ajaz University Veterinary Teaching Hospital, Turkey. Former veterinary doctor, Bharia Town Zoo, Dog Kennels and Riding Club, won United Nations Pakistan Youth Icon Award in 2016. We are honored to have her on board. She will share her clinical experience and insights on the topic feline infectious peritonitis, which is the main highlight of her research work as well. Please join me in welcoming him.
Assalamu alaikum, everybody. Can you hear me?
yes.
Yes, ma'am.
Okay, just give me a minute. I'm unable to show my video. Can anybody help me with that, please? Okay, I'm done. Can you guys see me?
Yes, yes.
Yes,
Okay,
ma'am,
thank
we
you
can.
so much. Okay, thank you so much. I'll go in the presentation view and please tell me if I'm full screen or not.
Yes, yes. You are not full screen, but you can share your
Okay.
presentation.
Am I full screen now on the presentation?
Yes, ma'am.
Yes,
Okay.
Yes, ma'am.
Thank you, everybody. I'm Dr. Humaira Ahmed Khan. I am MPhil in Veterinary Internal Medicine, and I am CEO of Vet Lagari Animal Hospital in Lahore, and I'm practicing there. So before that, I would like to thank everybody for coming here because I also happen to be one of the people who were behind the conference. So it could be a little part, but yes, I did try my best to make it happen. Thank you, Dr. Ajaz. Thank you, everybody. I would especially I would thank Dr. Mazhar Iqbal for being here. He's my mentor. I'm learning orthopedics from him. And also Madam Aneela, who is my inspiration and who keeps on giving me a thumbs up on anything I do or everything I do. So I'm very honored to present with them today. So before wasting any more time, I would be starting my presentation, which is feline infectious peritonitis. So what we used to think as students when we used to listen to this name, we used to think it is something related to the infection of peritoneum cavity, which is actually not, and not many of the people know. So in my MPhil, I actually worked on the cases of feline infectious peritonitis, and I was honored when Dr. Ajaz chose this topic for me because he thought I could explain it more. So basically, what a feline infectious peritonitis is, this is our question, and then we will come to know how to treat it. So first we need to learn about it. So yes, it is feline COVID, like it is coronavirus infection. But do you know, in cats and dogs, coronavirus just causes mild diarrhea or like enteritis. So how does it happen in a cat that it goes so far, like just the 95% of the cats die? So basically, it's a misnomer, which means it is an inaccurate name given to the disease. And it is basically the lesion of this disease is actually vasculitis. So that is the inflammation of the blood vessels. So wherever the virus or whichever side of that vessel or that organ will be affected by that virus, that sign will be our major, you can say, consideration. So feline infectious peritonitis mainly affects the peritoneum and its areas, but it also affects some other areas which we'll be discussing. So before the clinical examination, we need to remember these steps so that we don't give any wrong diagnosis to the, you can say, the pet parents. I don't call them client anymore. I call them pet parents mostly. So we can't just say, okay, it's feline infectious peritonitis, your cat is going to die. No, this is not how the vets do. So important cause of death in purebreds. So always remember that. Why? I will ask this question as well. So mostly the pedigreed cats are affected, and the most important breed that has been seen in the world is the Bengal cats. And then this disease happen in multi-cat household or the cats that have been rescued from shelters. So it is basically happening because of the stress, because of the depression, because of the breeding, because of a lot of other factors that are kind of affecting this stress of being overpopulated. And before the clinical examination, you also should note that there are two forms of FIP, which are effusive, the wet form, and non-effusive, which is the dry form. So on the basis, if you know these 3 points only, you're able to actually do the clinical examination. Being a good vet of the future, you people are going to diagnose it very well. So let's talk about the effusive form of FIP. As you can see, what is happening over here? In the peritoneum, you can see ascites, the accumulation of the fluid. Just 2 days ago, Dr. Ajaz shared a video with me where he was actually taking the sample from the ascites or aspirating it to test that sample. So yes, this is how we check the FIP, or we do the first test that is called the Rivalta test, which I will be talking about now. Okay, so this is basically the effusive form of FIP. When you see this type of a cat that has come to you and there is no other history like trauma or something that can cause the accumulation of fluid, then just keep in mind the differential diagnosis, or the first point should be FIP, which is feline infectious peritonitis. Let's talk about the general other symptoms. There will be a gradual or sudden onset of fever that will not respond to antibiotics. There will be a severe weight loss, there will be lethargy, there will be fluid accumulation in the abdomen that we call ascites, there will be jaundice, there will be eye problems. Now, why are there eye problems in a case like FIP? Like I told you, it is actually vasculitis. So if the blood vessels of the region that are giving blood supply to the eye are affected, then obviously there will be eye problems. And most of the cases of dry FIP that come to us come with uveitis. Okay, so keep in mind, this is a very, very important clinical sign. I have treated 48 cats of FIP during my MPhil thesis or research, and 20 of them were dry FIP or combined FIP form. Neurological signs do come, but in a very, you can say, prolonged stage, and if the cat has not been treated for a very long time, but they do come. Okay, one important thing that can differentiate between a dry FIP and a wet FIP is that there will be, okay, so you saw there is a fluid accumulation, you call it a wet FIP. Okay, so you just call it FIP. most of the people think, or they used to think that FIP is only the fluid accumulation. No, if in the omentum, you know, the omentum region, which is right where the pleural effusion happens, if there is a cake-like structure, there is fibrous adhesion that is thickened, and you can feel it that there is something wrong, just always keep the dry form of FIP in your differential diagnosis, not just wet, always go there, okay? So these two symptoms are the symptoms that are mostly seen clinically, like in more than 80% in the classic wet form. We will see, you can see the effusion, the ascites in the cat, and also the ocular manifestation of the disease, which could be uveitis, it could be hyphemy, it could be keratitis precipitates. They all could be together. There could be worse cases like ulceration or something, but do keep these differential diagnoses in your mind. If you know that more than 3 of the clinical signs are coming, you must go for FIP. Okay. Before the diagnosis, let's talk about how it's transmitted. So basically, as you know, the COVID, or you can say the coronavirus, is basically shed through feces because it causes mild enteritis. And it can be transmitted between cats through direct contact or contaminated objects, like I told you in the multi-cat households. Mother to kitten transmission can also occur, very, like it's in the research, it has been given that there is genetic disposition, which is mostly why the purebreds are responsible for having this disease, or they are more prone to this disease. Okay, let's talk about the diagnosis. So, okay, you have the fast test FIP that, as you can see in this picture, but do you really think it is a test that can tell you that there is a FIP or there is no FIP? Basically, the manufacturers of these tests mislabel them. This is not a test for FIP. This is a test for coronavirus, which detects some of the coronavirus in the body of the cat. But to see the exact FIP, no such test has yet been, you can say, given in the market or published, because it's still under the research. So we have to go for multiple tests. We have to go for clinical signs. We have to go for lab tests. We have to go for history. We have to go for Rivalta test. The first test that you can actually do as a veterinarian, even in Pakistan, in your clinic, if you have no access to rapid test, yes, we do have rapid test access nowadays, but if you don't have it anymore, or, yeah, like for example, if you're living in a farther area like DI Khan or somewhere, and you are unable to get a test in the time period you need it, go for Rivalta test. What is Rivalta test? So I will talk about it. This is me treating a FIP case. I just wanted to show this to you guys. So we did the ultrasound, we confirmed there is the effusion. And what is the test that I'm doing right now? So basically, I was actually checking the urine of the cat. There is proteinemia that happens in these cases. But then there is another case that is Rivalta test. And how do you do it? You take a test tube. You actually take just like 10 ml of water, normal distilled water, on a very normal room temperature. Don't go for iced water. It will not give you good results. I have checked it myself. And then you take acetic acid. What is that? Simple vinegar. Just take 2 to 4 drops of acetic acid. Put it in the water. And then the effusion, or you can say the exudate that you just aspirated out of the, you can say the peritoneum cavity, you just put 2 to 3 drops in it. If you see that the mixture has mixed inside, or there is cloudiness, it is FIP negative. And most of the time, you can say the negative is 97% no FIP. Andy Eddy says that, who is the most biggest researcher in this field. And if it is positive, it will show you some drops, like teardrops like structure, and it will not be, you can say it will not get diluted in the field. I will show you over here. As you see in this picture, there is this, the aspirated exudate that I took. And over here, the teardrop form is actually the form I'm talking about. So this is how you get 86% FIP positive. Before going for rapid tests, before going for any other serology or anything, yes, they are important, but this is what is going to give you most of the answers. So this is one of the cases that we treated. I wanted to show this picture because as a clinician, you should always know it's not always very easy to treat such cases. The cats also get depressed and bored. So I just left the cat for just 2 to 3 minutes and she jumped on the ultrasound and she was not ready to come out. She was very angry. It took us half an hour to get her back to the pavilion. So, and one of the things is that she actually survived the treatment protocols, but after 3 months, she passed away due to the other complications. So she was one of the important cases I remember up to date. So these are some test reports that I wanted to add over here that I just wanted to explain that the respiration rate will always be higher in the, you can say, the physical examination. So you know why it is. So, and also about these, because I actually compared FIP in my research work, I compared FIP with other infectious diseases of cats. So I always used to get the significant data because FIP is the worst cases that I have seen in my life. So the total protein, the albumin globulin ratio, the creatinine, everything is going so, you can say high and down, and you must know things on the fingertips, but it's like a research-based thing. You shouldn't be knowing a lot of it in the clinical examination, but just go for the albumin globulin ratio. You can easily take it out, and albumin globulin ratio is very, you can say, it should be less than 0.4, and you will know that it is FIB positive. Okay, we already went through this one. Okay, let's go for the treatment. This is the drug that is GS441524. It is known as something that can treat FIP, but to be honest, it only prolongs the life because it actually supports the anemic adult cats. It supports the immune system, nervous system, and digestive tract. It's only supporting, not treating the infection. Remember that. And also remember, this is an experimental drug that you need to import from some countries. In Pakistan, it's not available. In Turkey, I used to import it from China and some other countries that were actually that had actually signed the MOU with my university. So medications we use the supportive medication basically for the inflammation, for the affected organ treatments, for the managing and supporting care, and also giving some instructions to the owners for how to treat this disease. How to prevent it is, why is it important to prevent something? Because it is happening in the multi-cat household. So we have to guide the owners. We have to be their guide for how to manage hygiene and also the risk exposure of feline coronavirus in multi-cat environment. There is no foolproof method to prevent this disease. So I can clearly say it is untreatable, but don't ever leave your clients or your pet mommies and daddies in a way that, okay, I can't treat this disease, the cat has to die. No, you have to keep on helping them. It is a possibility that in the future, the experimental drugs do help you. So, okay, this is something I wanted to introduce to you guys. This is called cat interferon. Why is cat interferon normally used? Do you know why it's used? Cat interferon is basically something that is helping in the cases like cancer, some other cases like leukemia and other things. So it is basically helping the cat to survive. Normally, the time period we used to tell, or we still tell the cat owner for the survival is 2 months. Maximum 2 months, but this drug can actually elongate or increase the time period. So, and yes, if you don't have this disease, you can go for human interferon as well, but only orally. This one, the cat interferon, has to be given either by eye drops or orally. So yes, you also have some, you can say in the local languages, we use some words for, taking out some ways out to find a good solution, the jugaad word. So that is actually human interferon is a very good jugaad for preventing this disease. And general helping medicines that I wanted to add here, because that actually helped me while treating the FIP viral diseases. The Falovir paste, the Pet Immunix, Xylexis, Filgastrim, they all are immune boosters. In one way or another, they are immune boosters and they boost the immune of cat. And what will happen when the immune will be boosted? The natural body mechanism, the white blood cells will be enhanced. They can fight back the infection, and the cat will also feel better. That will be less stressed. And you can say you will be treating the cat less. So
Dr.
there are
Humaira.
other alternatives. Yes, yes. The last slide. It's the last slide, sir.
Yeah.
I calculated the time. Yes. So alternative medicine is basically, this is what I'm using in Pakistan currently, because the previous ones, I have no access to any of these. I did import some of them, but yes, obviously I can't import more than 2 to 3 bottles unless I have the license. So these are the alternatives that I have used in Pakistan. If you can take the picture, because I have done a lot of research to make it possible for pet mommies and daddies to be able to treat this disease or help their patients when they are actually dying or in the process. So yes, thank you so much for your patience and trying to learn FIP from me. We have some questions now. If Dr. Ajaz can actually allow me, I can ask these questions.
Sure. Go ahead.
Okay. So I will go, I will just take myself off the full screen because I will be able to see the students. So you have the question. So based on what you've learned today, what do you think? Why certain purebred cats like Bengals are more prone to FIP? Like in Pakistan or in general Southeast Asia, we think that the purity is very important. Nasli hona is more important. So why FIP is actually happening in Bengals or purebreds more than the other ones? Yes, Tanveer, you can answer.
Ma'am, because it can transfer from mother to offspring.
Okay. Thank you for the answer. I was actually expecting this answer from all of you, but let me explain this answer. It is because of the genetic predisposition. You can search this terminology online. You can learn about it from your ABG teachers. Genetic predisposition and variation in the immune response make them more susceptible to feline coronavirus or the mutated form, that is FIP. This is the answer. It is very important. I happen to have it in a lot of exams as well. So I have this other question, which is, if you encountered a suspected case of FIP in your clinic, what diagnostic tests would you prioritize and why? So I just want you guys to tell me which one will you do and why would you do just a couple of them. Yes, Malaika Farooq, would you like to answer, please?
Yes, the first diagnostic test we should go for is Revolta test, as
Yes.
it can be like, because of the Revolta test we can get the instant results in the lab. So basically what we are going to do is take 10 ml distilled water.
Okay, Malaika. Thank you so much. Your answer is right. Which institute are you from?
RC Vets.
Rifa College.
Lahore.
Okay, thank you so much, Malaika, for your answer. And yes, this is the first test, and then we go for the rapid test, and then we also followed by the CBCs. And yes, like I told you, the albumin globulin ratio is very important. You have to go for the biochemistry as well. Just last question, and then I'm saying bye to everybody, which is, considering the challenges in diagnosing FIP, what strategies would you recommend to improve early detection in multi-cast households? Like, what should be the early detection? What do you think? Like, I didn't tell you this thing, but what do you guys think should it be? So we have, can you please raise your hand, guys, if you want to answer me?
Hasibur Rahman, please speak up.
Hasibur Rahman, if you want to answer this, you can answer.
Okay. Mostly हमें हिस्ट्री बड़ी मैटर करती है. Mostly हम जो तकरीबन 50% केसेस जो हम रिसीव करते हैं उसमें होता है कैट जो होती है ना मल्टी कैट इन्वायरमेंट में ऑफनली सिक हो रही होती है. हल्का सा उसको कोल्ड होगा तो फ्लू होगा, कुछ भी इस तरह का फ्रीज आएंगी, ब्लड प्रेशर अर्ली हो जाएंगे, उसको बाकी की एक्सेस की इम्यूनिटी लो रहती है. तो दैट इज द हिस्ट्री दैट मैटर्स a lot.
Yes, I know. Thank you so much, Hasib. You're not wrong. Sorry to interrupt. You're not wrong, Hasib. But what should be the strategy to improve? As a vet, what do you think is the strategy to improve it?
Normally
what will you do? What will you do as a vet? What will you do?
Normally, we have the pepper kits available and we do the HG ratio when we suspect the case from the history.
Okay, thank you, Hasib. Anybody else who want to add up to Hasib? Tanveer Ahmed, do you want to add up something? No? Okay. There is another one.
Natasha,
Farhan,
please speak up.
Okay.
Okay, so I will check I will check for the coronavirus titers because it is the coronavirus that gets mutated and that causes FIP. So
Okay. Okay, so
what did-
you will take all the cats from the cat household and you will test them for coronavirus, right? Is it true? If you're working on a shelter or you're actually having somebody like I work in the Valencia town and there is DH Rabber and one of the house has 25 cats. Will you check all of them for coronavirus? No. Let me, if you allow, I can answer now. Dr. Ajaz, do you want me to answer now?
Yeah, go ahead.
Okay, okay. So basically, when you open a clinic, like Dr. Ajaz, his client was saying he operated a lot of my dogs. So what happens? They become your family. They are your vet family. So I call them vet family or my family. So if you know a multi-cat household that comes in your vicinity, you have to do regular monitoring of their hygiene practices. You have to educate the owners. And later, like your first of the Hasibur Rahman said, you have to go for serology test, antibody detection, PCRs. But I would definitely recommend don't go for that. Nobody's going to afford that. You're going to lose your money as well. So regular monitoring and educating the owners about the disease and how to prevent it in the management is important. And also in my research work, I tried to develop a very good thing that is actually alpha glycoprotein, and which is the early diagnostic kit, and inshallah in my PhD that kit will be in the market. That is my future preparation. So inshallah you people, when we become the vets, you will have something to deal with. Thank you so much, and thank you for answering.
I have a question.
Thank you.
Yes. Is it a question? Questions have to be asked
When
at the
you,
end according to the excuse me, question has to be asked at the end according to the principle of the conference. So I will not go wrong with the principles. I'm a disciplinary person, so I will wait for your question at the end. Thank you so much.
Thank you, Dr. Humaira. Thank you very much for your very nice presentation.
Thank you, sir.
Let me give you something like in 1 minute, okay, what we do in USA about this disease, FIP. The good news is that in USA, we have 100% treatment available right now. And we treat like 4 cases, and 4 cases they recover. No, they are free of FIP. There's no FIP symptom. We check like with a titer, we check library, everything. Dr. Fran, who cleared the NAVLE exam, I think he's also right. There's a test available right now in USA. It's called like a 7B. This is also like a board question. There's 100% detect. Also, we check like a fluid. We send to the lab. The result is coming back FIP positive. And also, there's a why FIP. Why we call FIP is a coronavirus. Coronavirus is very mild symptom or something like it does not do anything. We see a lot of things in the shelter cat. All the shelter cat, they have a coronavirus, okay. It does not mean they develop FIP. FIP only develop when the genetic material is changed inside the virus. And that virus then become like a very fatal. It's the same virus, just like AIDS virus. It become like a genetic material change inside the body and become like a very fatal. That's why the treatment is very difficult. But this treatment, GS441524, right now is a FDA approved in USA, and we're treating this one. Before, we don't have this medicine. We have some people here in USA, they export from the China illegal way, and they treat the cat, and we see the result also. They have injection form and pill form. The both are working very well. Injection is also working very well, and the pill is also working very well. And Dr. Humaira, you can get this medicine from China, but it's expensive. In USA, for the treatment, full treatment, it costs like $1,600 to $1,800. Plus, the test visit is separate. The diagnostic, ultrasound, all these are the most. It costs almost like $7,000-8,000 or maybe $10,000 total treatment. I don't know the Pakistani people, they afford this treatment.
Okay, can I ask you a question regarding to this medicine? because I recently have a client here in Pakistan who actually imported it for his cat. And according to the rules that I have learned in my research and everything, we have to inject a slow dose up to 65 days. So is it the same protocol that you guys use? Because I have used it and the cat is very well yet, but I can't say the cats survive, because as you have a lot of cases that are surviving, but I don't have that much number of cases. So is it the same protocol that you are using, subcutaneous injection up to say 65 days?
Yeah,
Is it
the
the same
injection,
alternate days? Okay.
the injection, we are not using injection right now. Injection before
Okay.
we have the people they are using, and we see very successful rate.
Yes.
We see a very successful rate. And right now we have available, and it's very successful rate. Is according to the body weight also, because the body gain.
Yes, exactly. The one
So
I'm talking
pills
about.
also
Yes.
same thing. Okay.
Yes.
I think we want to move to the next speaker.
Yes.
We don't
Thank
want to
you
waste
so
our time.
much.
Thank
Thank
you.
you so much.
Sir, please make the co-host Dr. Natasha. Please, ma'am, raise your hand if you are here.
Thank you so much, ma'am Humaira, for wonderful presentation. Our seventh speaker is Dr. Natasha Ghafoor. Shifting focus to ruminants, Dr. Natasha Ghafoor. Dr. Natasha Ghafoor, well known as Dairy Girl, is basically from Faisalabad, working in dairy field since 2016. Post-graduation in animal nutrition from UAP, graduated from UAF as DVM, worked at Pakistan's biggest corporate dairy Nishat Dairies, also started work in sales and marketing in KPK region, and she was the only female there at that time in KPK who was working at farm level. She has launched her dairy startup named as Dairy Girl as founder and CEO, through which she has connected with different dairy farms as dairy consultant in all over Pakistan and also with stakeholders. She has also delivered trainings to FAO, UVAS, CUVAS, BZU Multan, CVS, Chang, and many online trainings to DVM students, vet professionals, and many field trainings to dairy farms. Other than that, she is a certified lead auditor for ISO Quality Management System by IRCA. Also awarded and served as Global Peace Ambassador by Global Peace Chain for the year of 2018 to 2020. Executive Board Member of National Agriculture Youth Commission of Pakistan. She has also acted as a worthy judge at different business ideas, competition, and startup expo. A dairy field expert will present on DCAD management in ruminants. Please join me in welcoming him.
Dr. Natasha, you hear me? I make her co-host, I think. Dr. Natasha, you hear me? Yeah, okay. Okay, Dr. Natasha, go ahead. Please
Yes, she is
unmute,
setting up the stuff.
unmute your speaker on.
Yes, sir. Ma'am, you are unmuted and you can speak up if you set up your all the stuff, your presentation and other things.
Dr. Natasha, you.
Dr. Miraj, can you call her, please, if she's facing a difficulty, maybe to unmute or something? Can you call her and help her out?
Actually, as per my screen, she's unmuted herself, but she's not speaking.
Just call
Let
her.
me call
Just
her.
call her, please. Just call her, please, to make sure the speaker is not facing any difficulty. Just please call her. I don't have her active number, or maybe I do. I will call her as well.
Yes,
Just call
I'm
her. Yes, please. Just to make sure she's not facing any problem.
Dr. Natasha, please. Can you start your
Sir, I
presentation?
just called her. Actually, due to my Zoom app, I am unable to speak with her, but I left the
I'm calling her.
text.
I'm calling her. Don't worry. I'm calling her. Just give me a minute.
Sure, ma'am. Please.
Give me
Thank
a
you.
minute.
Who's the next speaker? Okay, can you give me her name?
Dr. Humayoun. Dr. Humayoun, sir.
Dr. Humayoun.
Can you raise your hand, Dr. Humayoun? Please raise your hand. Dr. Humayoun, please, can you raise your hand?
Dr. Humayoun, are you here?
Yes, I'm talking to her. She's actually facing difficulty in unmuting herself. Can you do it manually for her? She is there. She's been trying, like I told you.
Miraj, can you do that?
I can't
Yes,
find
I'm
her
doing.
actually in the participants. If I could, I would have done that too. Ma'am, can you raise your hand, please?
She muted.
Yes, ma'am. Please speak up. I think that she's facing some issue with her mic. Maybe. The permissions to Zoom, sir. Sometimes if we are using Zoom for the first time, we have to give permission to that specific app Zoom for mic. Okay, please raise your hand, sir, Dr. Humayoun. Dr. Humayoun, please raise your hand.
Dr. Ajaz, she's saying that she's fixing the issue. The next speaker can take over for a while.
Okay.
Thank you so much.
Miraj, can you see the Dr. Humayoun or the...
Sir, he is here with the name of Humayoun Farid Vet. Yes, please, if you can search her first prefix HUM, then the name of his ID will come first. Humayoun Farid Vet.
Okay.
Then you will be able to make him the
Make a
co-host.
co-host, okay.
Yes, you did. Okay. Please, sir, just I am
Humayoun,
sharing your
Dr.
presentation
Humayoun, can
here.
you hear me?
Hello, can you listen me?
Yeah, we listen to
Yes,
you.
we can, sir.
Miraj, let's go with the host, okay.
So
Dr.
our
Humayoun, I'm
80
sharing your screen.
Okay.
Just give me 1 second.
Dr. Maira, please introduce himself.
So it is my honor to introduce Dr. Humayoun Farid, a renowned veterinary expert with a distinguished background. Dr. Humayoun Farid holds a DVM and MPhil and specializes in falcon medicine with a focus on breeding consultation. With 5 years of experience as a senior vet surgeon at Ilzam Falcon Vet Hospital in Doha, Qatar, Dr. Humayoun Farid brings a wealth, knowledge, and expertise to our conference. Please join me in welcoming Dr. Humayoun Farid to this conference. So you can start now.
Assalamu alaikum. I would like to thank MGEU for all the support and for inviting me to share with my love and passion for falcon medicine and falconry, and to you all for participating in this presentation. So here in this one first image, you can see the setup of surgical department. Please, next slide. Next, please.
Yes, sir. I did, just due to the network. It will show in front
Endoscopy. This is the Greek word. Endon means inside and scopion means to examine. In raptor medicine, we used to do on daily basis otoscopy. That is the examination of the ear, rhinoscopy, examination of the nasal cavities, pharyngoscopy, examination of the pharynx, tracheoscopy, examination of the trachea, ingluvioscopy, esophagoscopy, gastroscopy, cilioscopy, colectoscopy as well. Next, please. So those are the equipments and materials we used on the daily basis to run the cilioscopy, like light source, halogen, xenon, LED. There is video system, video unit plus video camera, high resolution monitor, computer plus program to manipulate and store photographs and videos, fiber optic cables, rigid and flexible endoscopes, trocar and cannula. Instruments for general surgery, rigid and flexible endoscopic equipments. Next, please. So those are the instruments like biopsy, forceps, trocar, cannula, and the scope. And we buy these instruments from GSG. Next, please. Endoscopy, examination of the pharynx, scrope, esophagus, trachea. Always carry out this examination with the bird under general anesthesia. Condensation and obstruction may occur up the tip of the endoscope. Actually, we use this type of examination under general anesthesia. Sometimes we use under isoflurane and sevoflurane. It depends upon the procedure what we are performing. So examination of the trachea, this should always done under isoflurane, under deep anesthesia, normal anatomy of the trachea and tracheobronchial pharynx. This is, here you can see the presence of foreign bodies, parasitic infection, trichomoniasis, and aspergillosis. Sometimes pseudomoniasis can also be occur at this point. If we see the clinical symptoms in this image, there is dyspnea, vessels and ventricles, because of there is bifurcation, and there is obstruction at the one point, respiration at 2 steps, and we should resolve this matter according to the surgical and topical appointment. Complication, unilateral and bilateral pneumonia, unilateral and bilateral inflammation of the air sac wall. Next. Endoscopy examination of the upper digestive tract. Here in this image, you can see the ingluvis or crop, esophagus, proventriculus, and ventriculus. So this is the normal image. Next. Those are the parasites of the esophagus, Paraspiralta sacchari and Physoloptora alta alta. Next, please. This type of infection leads to the presence of caseous nodular and membranous growth, infection in the crop due to Trichomonas gallinae. Infection in the crop and esophagus produced by Trichomonas gallinae. This type of infection
This is the parasitic infestation, and this causes the blockage in the guana, and you can see the pinpoint spots on the tongue also. Large caseous nodular growth producing partial obstruction. This is the endoscopic examination of the proventriculus and ventriculus. Whenever there is gunshot wound due to the falconer, and the bird is ingested and it goes inside the crop through the proventriculus and ventriculus, and there should be the extraction. The extraction of lead pellet from the gunshot can be achieved by flushing the ventriculus repeatedly. The extraction of large lead pellet from the air rifle requires in many cases the use of endoscope and the working sleeves and flexible or rigid long forceps. We use for this. So this is the normal topographic anatomy. Everyone should know about this. The liver, the position of the bird, like liver, heart, proventriculus, intestine, kidney, gonads, and lungs. Essential that the bird is in correct position to fix the legs and the wings to the table using masking tape, adequate preparation of the surgical field, surgical access 45-degree angle against the back and 45-degree angle against the table. Sometimes some of the second observer should handle the feather and the legs. The use of sterile clothing and sterile dress is indispensable. Instruments and swabs pre-sterilized. Always keep available sterilized saline solution to clean the endoscope and agent to avoid fogging at the tip of the endoscope. Video camera, 35 mm or digital camera video recording unit, a second observer attachment, direct connection to the monitor, computer and program to manipulate and store photographs and videos, achieve all the documents, all clinical science. This is the candidiasis, this is the fungal infection, serious condition in falconry, and diagnosis is relatively easy. Appearance of mucous membrane is very characteristic of this infection. Aspergillosis, this is the most common disease in falcons, the most important disease of gyr falcon and its hybrid in the Middle East, Aspergillus fumigatus, Aspergillus flavus, Aspergillus niger. Ceratospeculum surati. Ceratospeculum, the most common species found in the Middle East is Ceratospeculum surati. In the Iberic Peninsula and rest of the Europe, most commonly found species is Ceratospeculum tendo.
Dr. Humayoun? I think he's facing an issue with his internet, right?
He muting his slide, okay.
What, sir?
Why my slide is coming?
Sir, he unmuted himself. I don't know why. Maybe he's facing some issue. Yes, he just left the meeting due to any issue with his internet.
Yes, he just came back.
Let him make him again. He's already co-host, am I right?
Yes, he is co-host, sir.
Humayoun, Dr. Humayoun, did you listen my voice? Dr. Humayoun. Hello. Dr.
Dr.
Humayoun.
Humayoun, please speak up.
Can
Sir,
you
he has internet connectivity issue.
can you call him Miraj?
Okay, sure, sir. Just calling him.
Is he did not unmute his speaker. His speaker is still microphone is like a mute.
Sir, I'm calling, but it's not ringing. Actually, he has the issue with his internet connectivity, right? I'm calling, but not ringing. The call is not ringing, sir.
Okay.
Shall we start with Dr. Natasha?
Yes, yes. So if Dr.
Dr.
Natasha
Miraj,
has any problem,
wait a little with Dr. Natasha, please. She is currently solving it. Just give her some minutes.
Right.
Sir, our next speaker is Dr. Mohammed Rizwan Khan.
just give me 1 second. Muhammad Rizwan.
He is waiting for to present his lecture, Dr. Rizwan.
Dr. Humayoun Farid, you hear me?
Sir, actually, he is not in the meeting right now.
So
Dr. Humayoun Farid, he left due to his connectivity issue.
okay, so let's go with the Dr. Rizwan. I think that Natasha still has a problem. Okay.
Sure, sir. I am just fine. Yes, Dr. Rizwan Khan, he's co-host now.
Right. Can you
sir, please
stop
speak
sharing the
up.
screen? This one.
Sure, sir. Just I am stop sharing the screen. Yes, just go. Okay, sir. Yes.
So our ninth
Rizwan?
speaker is Dr. Mohammed Rizwan Khan. So Dr. Mohammed
Ji.
Rizwan Khan, working in Punjab Wildlife and Park Department for last 13 years, have served in Lahore Zoo, Jallo Wildlife Park, and currently working in Safari Zoo. Mainly worked on selection of birds, their breeding, developed 23 days chick rearing protocol for peafowl and pheasants. Expert in shifting and tranquilization of wildlife, zoo designing, development of zoo prophylaxis, and zoo nutrition. Wildlife health takes center stage with Dr. Mohammed Rizwan Khan, a senior wildlife veterinarian, discussing bird diseases management in captivity, covering breeding program, deworming, vaccination schedule, and diseases. Please join me in welcoming him.
Dr. Rizwan, please go ahead.
Sir, Dr. Natasha raise her hand.
You make him. Dr. Rizwan, please, can you start your presentation? After that, we can start the Natasha. Okay.
Okay, sir. Dr. Rizwan, sir, I believe that we made another person, a wrong person with another same name. Dr. Rizwan Khan, yes. Please raise your hand, Dr. Rizwan Khan. Please. There are two names. One is Dr. Rizwan Khan and other one is Dr. Muhammad Rizwan. Who is the actual speaker of this conference? Please raise your hand. We are waiting for your this act. Please.
Dr. Ajaz?
Dr. Rizwan Khan.
Sure. Dr. Rizwan Khan, please sir, make the Dr. Rizwan Khan as co-host.
Can he raise his hand?
Okay. He's unable to raise his hand. Maybe just he texted as well in the chat. So just make the Dr. Rizwan Khan as the co-host and remove the another person we made as Dr. Muhammad Rizwan. He's not the actual person we want here as speaker.
While Dr. Ajaz does this, I would like to tell that Dr. Natasha will be coming from telephone and I will be opening her presentation. So next will be her, inshallah. Okay, Dr. Maira,
Inshallah.
please do it. Hanji.
Dr.
Inshallah,
Rizwan, can
thank
you
you.
raise your hand?
Assalamu alaikum, sir. Sir, he just raised his hand. Please.
Okay.
Yes, sir. Yes. Now, Dr. Rizwan Khan, you are able to unmute yourself. Please unmute yourself and just we should start. Yes, you are. Here you go.
I'm very much thankful for inviting me as a guest speaker here in this international conference. I share my screen here. Yes, the topic to be discussed in this conference is bird disease management in captivity, the breeding program, deworming, vaccination schedule, and diseases. First of all, I will like to elaborate what is the difference between a poultry farming to manage the birds inside the wild and inside the captivity. For example, if we are managing a poultry farm is a well-maintained space in which we can medicate a whole flock very easily. Vaccination schedules are already set. Mostly SOPs are already set. Most research work has been done on the individual species, and usually on a farm, we work on a single species. As far as the wild is concerned, I'm talking about the jungle. Whenever you are talking about the birds in a jungle, we cannot do much for the birds which are being kept inside the jungle. We can only take care of their habitat. We can stop hunting. We can do some surveys for their sampling, which diseases are coming in the jungle from their fecal samples, from the feathers, etc. And very minor options are available for the medication in the forest. You may be done in some type of outbreaks. You can manipulate their drinking points, and sometimes you can offer them the medicated grains. And most of time we are unable to do nothing for the animals which have been kept inside the jungle. So there are many limitations for the wild birds. As far as the captivity is concerned, inside the captivity, what is meant by the captivity? The wild birds which has been kept inside the confinement, we say that we are raising the animal inside the captivity. For a vet, we have to understand and focus on different things, that many species usually we put inside a zoo So we have to think about all those species while managing their diseases, while doing their management. We have to see their behaviors, we have to see their breeding season. All the birds have different breeding season, so we have to plan their prophylaxis, breeding plan according to their season. They have different nutritional needs, and most of the time, the first barrier which we usually face is the stress. Usually, we avoid frequent capturing of the wild birds inside a zoo due to the stress management. They usually take much stress, due to which their health is very much affected. Then we have to consider their cage design. The prophylaxis for every is different. Prophylaxis for the small cages is different. In the same way, we have to apply the different capturing techniques for different wild birds. And in the same time, the keeper has also threat while handling such type of the birds. So human safety and the animal behavior is very much important to design a breeding program or prophylaxis in a zoo. So this is a complex scenario in a zoo to design their breeding and prophylactic plan. And some times, being the wildlife vet, we have to treat such a species which we have already not seen, which we have already not trained on. For example, on the right side, I have shown a picture of a white-backed vulture to whom I was treating in Changamanga forest, where we have make it the conservation body. And interestingly, while taking the blood samples, they have only one jugular vein that is on the right side. There is no jugular on the left side. So different types of features the wild animals have. We have to study those species individually. And on the left side, I have shown a bird by the name of cassowary. Cassowary is the very dangerous bird. If you don't take the preventive measures, it can just attack you on the chest and can open the chest cavity. And many keepers have died due to the attack of the cassowary in the zoo. So while working in a zoo, you have to consider all these things. I talk about these special things which we usually consider while designing a breeding plan and prophylaxis for prophylaxis and medication. Whenever we are appointed in a zoo, first of all, we make a chart, how many species are there, and to which diseases they are prone, and what type of diets we can give to the birds, because most of the time we have to medicate them through the diet, we avoid their capturing. In the same way, we have to consider their housing. The birds are very easy to capture, to medicate, to take their samples when they are kept in the breeding section, where cages are very small. But when we keep them in the bigger aviary, it becomes very difficult to capture them, to regularly sample them, and to monitor their health activities. So we have to plan some different techniques inside the aviary. Enrichment is the basic thing which we usually have to monitor in the zoo. Most of the birds are featherless in the zoo. Why? Only because their enclosures are not enriched. In Lahore Zoo, I was having the cases of parrots, and they were all featherless. And being the vet, usually we recognize that it may be a vitamin deficiency, it may be the ectoparasites. But what I did, I only put some branches of the trees there and some good food points, good watering points, due to which both those birds start enjoying and leave their pricking of the bird their feathers. And after 1 month, they have recovered all of their feathers. So enrichment means to make the enclosure healthy for the birds so that they may enjoy. Interestingly, the social grouping. Social grouping is very much important for the zoo birds. Why? Sometime while in breeding season, I was grouping pheasants. There was a pheasant, namely the some fireback pheasants. I put a female in the enclosure of that male, and I was astonished. After an hour, the male has killed that female. That was the territory behavior of that pheasant, that he did not accepted that female, and the bird was expired after an hour. So we have to also keep in mind these factors. Whenever we join a zoo, we should take the history of the diseases in that zoo, in the surrounding, and in that country, and then for every zoo is different. For example, inside the zoo and safari zoo, usually we only vaccinate our peafowls and pheasants for Newcastle disease and avian influenza, because we are not facing those diseases which are typical to the poultry industry. In the same way, we have to manage the sex ratio. For example, if we are breeding the black swans usually remain inside in a pair, and they breed in a pair. If we talk about the pheasants, they usually breed in the 1:5. If we talk about the turkey, they breed into 1:2 or 1:3. So according to the type of the bird, we have to keep their sex ratio for successful breeding. And I have already talked about the cage type. Every or small cage, all cages have different management and different prophylactic ways. As far as the breeding is concerned, in breeding starts from the healthy parents. Usually inside a zoo, we have the issue that we don't do the selection of the parents regularly, and we have the issues in the chicks like the curly toes, poor feathers, poor demarcations. So from the breeding season, we select the healthy parents. We do their DNA if we cannot identify them physically. So it starts from the healthy parents. Then those birds are put into their special breeding cages, because if we are to keep those birds into the display, then we cannot expect a good breeding from them. So in the zoo, you have different sections. If you want to take good breeding, you will put those birds into the breeding section. And if you want to put them for the display, then usually we put those birds inside the aviary. Then egg collection is the procedure. Usually we have to collect these eggs three times a day, so that they cannot get infection from their bedding. Then we decide according to the species, according to the facility and in that zoo, whether we will take it to the natural incubation or the artificial incubation. If we decide to do it with the artificial incubation, then we have to take it in the hatchery. And what is the difference between the hatchery of a common chicken and hatchery of a zoo? Hatchery of a chicken or in a professional hatchery, usually there is a procedure, all in, all out. We put all the eggs one time into the incubator and then into the hatcher, and they go for the hatching. But usually in the zoo, we continuously put the eggs inside incubator, inside a hatcher. So mostly the incubator, despite of all the efforts, remain little bit infected, because we are putting all the time eggs inside, and we are hatching those chicks out of that situation. As then we bring these chicks for the brooding and rearing, where I have developed a 23 days chick rearing protocol with the help of Professor Dr. A.D. Anjum. And that is Alhamdulillah, very successful protocol. When I was appointed in the Jallo, their survival rate was 700 chicks a year. And within 3 to 4 years applying that protocol, we have brought this production to the 6,000 per year. In that, considering that issue all in and all out, we gave prophylactic antibiotics for the first 5 days along with the amino acids. then amino acid 2 days a week regularly. And then we give the spray of anti-vaccine every week. When they reach the age of 21, we give the anticoccidial course to them. And we have seen the tremendous result after implementing this protocol. And for the genetic improvement, we have to do continuous culling. Every year, we examine our flock and check those birds which are not good for the breeding and cull them. And so we improve our flock every year. As far as the disease management in a zoo is concerned, the major points we deal here is the prevention of endo and ectoparasites. The fungal issues are resolved. Then we implement a vaccination program. As I have already said, every zoo has its own vaccination program according to the history of the diseases in that zoo. Supplementation is very much important. We do the supplementation whole the year. Usually 2 days a week, we supplement the birds. And in the months where it is expected, there are the outbreaks of the diseases in the surrounding. And then we give them the specific immunity booster that according to the history of the disease pattern here in Pakistan, in Safari and Lahore Zoo, we usually give the immunity boosters in January and February and August and September, where the weather is changing. Enrichment is the key thing to be done in a zoo, which usually gives results more than the medication, more than anything. You continuously disinfect the cages according to the disease load. Usually after 15 days, we spray in our cages, and in the stress seasons, in the disease seasons, we increase their frequency. The most important in the disease management is the quarantine. Usually, we bring the birds from the sir.
Dr. Rizwan, please, can you wrap up your subject because your time is over, okay?
Okay.
Thank you. You have 1 minute, okay? You can wrap.
Okay. So in a zoo, we do the continuous research, update our prophylactic plans, utensils, cleanliness is very much important. Bedding is very much important. Usually if we put the sand bedding under the small chicks, you will see the eye problems due to the small sand particles, and we will be giving the tylosin, but that will be the issue of the bedding, which can be resolved only by replacing that bedding. Perching is very much important. We usually don't use the hollow perching, which allows the insect development inside the cages. In the same way, there are different management in the summer and the winter season. And the last one, but not the least, the heat source is very much important for the sick birds. Usually we see we treat the small birds without providing them the heat source to the sick birds, and they don't recover. And sometimes by providing only the heat source to the sick birds, they recover very tremendously. Thank you very much. So nice of you. Hope it will be good for the all. Thank you.
Thank you very much, Dr. Rizwan. Thank you. Let's go the next one, the Dr. Natasha. Dr. Natasha, Dr. Rizwan, can you stop your sharing your screen? I'm going to share you. Dr. Natasha, you hear me now? Can you tell the Dr. Natasha unmute the speaker? Who's the next speaker, like Dr. Amir?
Yes, she just unmuted. Ma'am, please speak up. Dr. Natasha, we are unable to listen. We can see you that you unmuted, but we are unable to listen you, ma'am. I think the same issue, sir, she is facing, right?
They should check like before the Zoom meeting. They should make sure that their laptop, speaker,
Right,
and everything is okay.
Okay, actually, Dr. Humaira Khan.
Dr. Miraj, can you unmute Dr. Natasha, please?
Yeah, we unmute already. Okay, it's unmute.
She needs to be
Ma'am,
manually
when
done
you
because
will.
she joined again.
Okay, ma'am, actually, yes.
Natasha, can you
No,
raise your
ma'am,
hand,
actually,
please?
when you will see her in the participants, ma'am, Dr. Humaira, when you will see her in the participants, you will see that she unmuted already.
Dr. Natasha, can you raise your hand, please?
Yeah, she
Yes,
raised her
now
hand.
she joined with another name, sir. Just
Yes, please.
Okay.
Can you make both of them the co-host, because from one of the login she will be sharing her PPT, and from the other
I
one
make
it will
the
talk.
both co-host. Okay.
Yes, please, sir. Thank you so much.
yes. Here you go, ma'am. Please speak up now.
Yes, sir. Can you hear me?
Yes, yes. Thank you.
Yes, we can, ma'am. We can.
Finally.
Okay. Okay, sir. I just share my screen.
Dr. Natasha, the voice is coming like a back and forth. You have a two.
Yes,
Yes, sir.
I
Sorry.
just
Sorry,
muted her.
Dr. Natasha, just mute one of your logins.
Yeah, she
and the
mute
other
one of the login. That's okay now.
Yes, please. Thank you.
Okay, sir. Can you hear me now?
Yeah, we hear you. Go ahead.
Yes, we can, ma'am.
Okay.
Thank you very much.
Okay.
Yes, ma'am.
Okay, sir. Very sorry for the inconvenience. I don't know what happened to the microphone.
Thank you.
So we start myself, Dr. Natasha. I'm an animal nutritionist and also working as dairy consultant and trainer and field researcher in the especially for ruminants. First, I would like to thanks to Dr. Ajaz and his dedicated team to make it all happen. This international veterinary conference. So my topic is decade management in ruminants. So let's start. What is decade? Decade means the dietary cation anion difference, and it is the index of the relative balance between the principal cations that are potassium, sodium, and the principal anions like chloride and sometimes sulfur in the cow's diet. And it's based on the strong iron difference theory and the effects on the body of the dietary concentrations of the major physiological cation anion. Sodium, potassium, and chloride are also referred to as strong ions because they are absorbed from the diet with nearly 100% efficiency. They remain completely dissociated in solution, and physiologically, any surplus intake from the diet above an animal's need will be excreted in the urine. So a decade is particularly important measure because it is used when formulating diets for dry period transition and lactating dairy cows, and because it is the interrelationship of positively charged minerals like cations and negatively charged minerals like anions on the animal performance. Basically, there are two types like dietary cations that include potassium, sodium, calcium, and magnesium. The absorption of the cations performs an alkalizing function on the blood pH. Nearly all of the potassium and sodium in the diet is able to be absorbed by the cows, and this is what makes these two minerals more powerful alkalizer. But on the other hand, calcium and magnesium are poorly absorbed, and such these minerals are rarely used to determine the decade value field. Other one is dietary anions, which include sulfur, chloride, and phosphorus. And similarly to the cations, there are two main anion minerals which have an effect on the blood pH, which are sulfur and chloride, which chloride providing the majority of the acidifying function. So there are two types of the decade diets. First one is positive decade diet. This type of diet is basically used in the animals which are given the less amount of the calcium and phosphorus as compared to their requirements. It is mostly given just after the partition or early lactation to increase the dry matter intake and to elevate the stress condition. For example, after the partition or early lactation, if the normal requirement of the calcium in the animal is 1.2%, and for phosphorus is 0.8%, and we are giving them 0.8% calcium and 0.4% phosphorus, which is far less than their requirement. So in this case, we have to give them a positive decay diet. In case we are giving offering feed to the animals which does not meet their nutrition requirements, means the feed is deficient in these essential macro minerals like calcium and phosphorus. So we must have to provide the positive decay diet. Other one is the negative decay diet. This type of diet is given in the transition period during the third trimester, most probably from the last 15 or last 21 days. And this diet is given to those animals who are given more macro minerals other than the normal body requirements, or in case we are feeding to the animals containing more amounts of the macro minerals. It is because the considered producing feed companies produce feed with the fixed amount of crude protein, metabolizable energy, calcium, and phosphorus. But the requirements of the animals fluctuates during the different phases of the pregnancy. And it is the equation for the calculating decay diet. Decay is equal to sodium plus potassium minus chloride, sum of chloride and sulfur. And what is the optimal level of decayed? Positive decay diet value should be plus 25 to plus 35 milliequivalent per 100 gram of dry matter. And for negative decay diet value should be minus 10 to minus 15 milliequivalent per 100 gram of dry matter. And what we can do with the decayed management? The feeding of a positively charged diet promotes an increase in the blood pH, and the contrary is true when the feeding a negatively charged diet. So knowing this, you are able to manipulate the acid-base balance to influence the other biological functions, optimizing production and the welfare of animals by providing the high or low decay diet at various production phases of animals' life. So there will be some consequences of not providing positive decay after parturition or early lactation. It may result in the milk fever, displaced abomasum, which also include LDA, RDA, decreased milk production, stress to the animals, weakness of the bones and muscles, difficulty in standing with called Downers Cow syndrome, and postpartum hemoglobin or red water disease. So in between these consistency, we will just focus on the displaced abomasum, which is the most common disease occurring in the commercial farming and also on the conventional farming with the 100 to 200 animals. But at the commercial conventional level, more farmers do not know about this type of disease. So awareness regarding the abomasum displacement should be given to our dairy farmers, so they also can get rid of this disease. So, displaced abomasum. As you can see in the picture, the abomasum is the cow's true stomach located near the floor of the abdominal cavity on the right side below the abomasum. The rumen and reticulum are above and to the left of the abomasum. And when the abomasum displaces from its normal position to the other left or right side, it is called displaced abomasum. And it also filled with the gas and fluid. And abomasum displacement is of two types. Left displaced abomasum, when abomasum is displaced to the left side. And LDA mostly accounts for 80 to 90% of all the displacement. It occurs when the abomasum moves to the left of its normal position, becoming trapped between the rumen and the left to the abdominal wall. Stretching result in the constriction to the entrance to and exit of from the abomasum, and it filled with the gas. But in case of the right displaced abomasum, the abomasum moves up to the right abdominal wall and becomes trapped above the abomasum. Like LDA, constriction of the outflow from the abomasum results in the accumulation of fluid and gas. However, in addition, RDA can also become twisted upon itself, which results in more severe clinical signs consistent with abdominal pain, elevated, which include elevated heart rate, signs of colic, right displacement is more serious condition than LD, and recovery rates are very low. Causes of displaced abomasum may include calving. The majority of the cases occur soon after the calving. During the pregnancy, the uterus displaces the abomasum, so that after the calving, the abomasum has to move back to its normal position, increasing the risk of the displacement. Second one is atony of the abomasum. If the abomasum stops contracting and turning over its contents, accumulation of the gas will occur, and the abomasum will tend to move up the abdomen. This tends to be a cause of the inadequate nutrition. And how decay can cause the displacement abomasum, because calcium is an essential mineral required for proper muscle and nerve functions. As we know, cows experience low blood calcium levels around the time of calving, are more susceptible to dystropia, uterine prolapse, and displaced abomasum due to decreased muscle contractions. And also subclinical and clinical ketosis can also increase the risk of abomasal displacement through an unknown mechanism that may be associated with the decreased rumen fill. Next are the clinical signs and symptoms of LDA and RDA. In case of LDA, this is where we will hear the ping sound line from the point of elbow to the hip between the 9th to 13th rib, means left middle thorax, and it will cause the drop in appetite, reduce milk production, reduce rumination, and also often resemblance with the ketosis, with ketone bodies in milk, blood, urine, and it is most likely to be occurred than the RDA. And with the right displaced abomasum, it shows more severe signs like colic, elevated heart rate, decreased milk production, low intake, abdominal pain, diarrhea, and fluid and gas filled with the abomasum, and its position will be more cranial than the LDA. And then the treatment, there is two types of treatment we do in the case of displaced abomasum, especially in case of the left displaced abomasum. We go for the conservative treatment, which includes the casting and rolling of the animal, which is the more useful, you can say, more useful method we are using here, especially in Pakistan. Casting and rolling of the animals, and we can also do a mentopexy, right parameter of abomasum means in the LDA we can do also roll and toggle, and also we can go for the surgical procedures. But in the LDA there is recommended one method is casting and rolling one. But in case of RDA, we should have to go for surgical methods, because it is a more severe condition than the LDS. It is the method of choice for the treatment of displaced abomasum, as it reduces the risk of recurrence and allows assessment to the conditions of the abomasum. There are a number of different surgical techniques we can use for the correction of right displaced abomasum, and the method chosen will depend on the veterinary surgeons. And we can go for the right palmarian abomasum and IV fluid. We can give them IV fluid therapy and electrolytes. And these are the roll and toggle material we use in the left displaced abomasum. These are toggle suture, trocar, canola with handle, and the last picture this is the assembled surgical instruments. And for the treatment, first picture represent the roll and toggle method in case of LDA, and second one is the surgical method. And in the LDA, the roll and toggle method, the cow is cast on her right side and placed on her back. It is very helpful to do this on a deeply bedded surface or on a soft earth space, since it is much more difficult to keep the cow in this position on a hard surface. Okay, for the prevention, prevention should be aimed at ensuring dry matter intake is maintained in early lactation. First one, ensure cattle are not too fat at calving, it should be not more than 3.5 DCS. And second one is feed quality high feeds and with quality forages, feeding a total mixed ration as opposed to concentrates. Ensure the plenty of space at feeding sites, minimize the changes between the late dry and early lactation ration. Also prevent and promptly treat diseases such as milk fever, mastitis, and retained placenta, which reduce the feed intake. And last one is maximize the cow comfort and also minimize the stress. And it is likely that a farm with numerous displaced abomination problem is feeding the late dry or early lactation cows go wrongly. So thank you very much. That's all from my side. And as far as the questions from the audience, my first question is, a 5-year-old Holstein cow is evaluated because of inappetence. On auscultation, there is a pinging over the left 9th and 10th intercostal spaces on a line between the tuber coccyx and the elbow. On paracentesis, immediately ventral to the pinging area, there are few drops of the green fluid with a pH of 6, which is the most likely source of the fluid.
Please, can you raise your hand?
Ma'am, most likely, ma'am, source of fluid may be abomasum.
No, I am asking which is the most likely source of the fluid, greenish fluid, where it comes from.
Ma'am, most likely source of fluid is the pH 6. It may be from abomasum.
But I think it is from Humana.
Let me unmute the next one.
Okay, second question is, what acid-base abnormality would be the most likely in a dairy cow with a displaced abomasum?
That's very important question that we see in the board also in Navali, the both question.
Okay, I repeat, what acid-base abnormality would be most likely in a dairy cow with a displaced abomasum?
Dr. Natasha, many people are answering you in the chat. Can you please check it?
Okay, I'm checking. Okay, Akhtar Zaman has given the right answer, metabolic alkalosis. Akhtar Zaman, where are you from?
Miraj, they can type the where they are from, which university they are belong, after Rahman.
Yes, sir.
Akhtar Zaman.
After Zaman. Dr. Natasha, you have any other question or that's it?
Yes, sir. I noted
yes,
down
sir.
actually. After Zaman is from BZU, sir.
Okay. Okay. Dr. Natasha, thank you very much. Thank you. Let's go for
Thank you, sir.
our last speaker, I think.
Thank you so much, Dr. Natasha. So our last speaker is Dr. Amir Rashid. The conference concludes with Dr. Amir Rashid. Dr. Amir Rashid is a dedicated zoo and wildlife veterinarian with an impressive career. Currently, he serves as the head of the veterinary department at 60 Zoo in Dham, Pakistan. Previously, he worked as zoo veterinarian at City Housing Zoo and Wildlife Projects and Day and Night Zoo in Karachi. Dr. Amir Rashid is also a skilled wildlife rescuer, notably saving a tigers from a posh area in Pakistan, which potentially saved hundreds of human lives. Additionally, he specialized in field anesthesia, further showcasing his expertise in wildlife care and management, presenting on chemical immobilization of big cats, lions, and tigers. Please join me in welcoming him.
Can he raise his hand? Miraj.
Yes, sir. Please, Dr. Amir, please raise your hand. I just shared your presentation. That's why I am unable to see other things. So please raise your hand. Sir will make you the co-host, okay? Yes, here we have Dr. Amir Rashid. Please, sir, make him as co-host. He raised his hand, sir, just by now.
Let him make the call.
Assalamualaikum, guys. I am audible.
Yes, yes.
Yes, we can listen you, sir.
Thank you very much, Miraj. Thank you, everyone. I guess the presentation is also on the point. My mentor, Dr. Akram, Mumtaz Khan Sahib, and then Mazhar Iqbal, and definitely the great veterinarian from Wildlife Department, Dr. Rizwan is here. Thank you everyone, to giving me an opportunity to discuss about the chemical immobilization in big cats, specifically in lion and tigers. Today we are going to discuss about the site of administration of DART, and then we will discuss about the some drug combinations, a story about the transportation escaping of a tigress that was transporting from Lahore to Multan, and how to recover the animal from the anesthesia. Next slide, please. Miraj, next slide. Thank you very much. The journal. So guys, the majority of the carnivores are classified as dangerous, therefore the daily examination at chemical general examination is not easy without immobilization. No doubt we can do some restraining, some psychological restraining, but again, there are some pros and cons of both of them. Today we're going to discuss about the chemical immobilization, and my focus will be on the chemical immobilization. Next slide, please. Here are some sites to administrate a DART in big cats. I always prefer the hindquarter. There's a reason behind, in active nature, where the wild animals are, and they are very active in nature. Whenever the animal, we try to approach the animal, or whenever we go on towards the captivity or the territory of the animals, they become hyperactive because of their wild nature. And when they are working, our previous slide, not please fly your slide. So whenever they are working or running to approach the forelimbs, that's why I will always prefer the hindquarter. Next slide, please. Here's some combination of drugs that we can use in a captive animals, in a wildlife animals. I just written about the animal medication that is available in Pakistan, and you can import from the other countries. I'm not writing about the thionyl and atropine because they are much expensive and not easily available in Pakistan. The most best combination and a lovely combination from my side is ketamine and midotomardine. We can use the ketamine xylazine combination that again is has on pros and cons in wildlife and wild animals and exotic animals. Tetraethylamine and zolazepam can also be used. And the second most important anesthesia, the combination is a petrofenol, azipirone, and midotomardine. That is a BAM. It's a great anesthesia and a safe anesthesia in the wildlife. I would love to use these anesthesia in a captive breeding. Next slide, please. Yes, because all the non-domestic feline family are harmful. Whenever we have injected the anesthesia or the DART in felines, the first approach should be gentle and the precautionary. Whenever we have to check the animal is in a conscious state or an unconscious state, we can use the extensions. You can use the iron extension to check the animal is a conscious or an unconscious state. The best way to check the animal from that he is in sedation or not is the ears, the hair of the ears. We can touch over the hair in the ear. If he's if you are you can say that hello, I'm audible.
Yeah.
Yes. Miraj, please last previous slide. We can check the animal is in a conscious and unconscious state with the help of some rods. You can use the extension of iron rods, I guess, and you can check from the hairs of the ear. If it's moving, that means it's in a full unconscious. If it's conscious and you are comfortable, then you can approach the animal with the gentle and precautionary approach. Next slide, please. The case of Zoe was reported somewhere in my zoo. I'm working in a C60 zoo and veterinary hospital. Zoe is a 3.5 years old beautiful girl. In this picture, we are representing the Zoe. And then we are gonna do an examination, a first examination, general examination, and repro scan of the Zoe. The drug combination I have used in this procedure was imidromidine and ketamine. The dose was 2.5 mg per kg ketamine and 0.03 mg per kg. And the antidote was atipamizole. The induction time was 11 minutes, and heart rate was varied from 51 to 60 beats, and respiration was 14 to 25 beats per minute. Next slide, please. This is the chart of during the anesthesia. We observed some variations in a TPR, that is temperature percent respiration during captive animal. The animal was very healthy, and this was just for a general examination and repro scan. You can see over there, the induction time was only 11 minutes, and then after the 10-16, the temperature was 101.3 Fahrenheit, and it varied from 99 to 100.3 Fahrenheit. In the same way, the pulse is varying from 50 to 60 per minute, and the respiration is varying from 14 to 25 per minute. And you can see there the pattern behind whenever the animal is gonna be long duration of anesthesia, the TPR is also changing. Next slide, please. Here, there's a story which was happened in Pakistan. I guess it was a good one of the first and one of the big rescue planning happened in Pakistan. One fine morning, we received a call from a wildlife department about the escaping of a tiger which was transporting from the Lahore to Multan. And at the Multan location, it was escaped from the vehicle and hid himself in a orchard of the organs. In these cases, just such type of operations, strategies and plans, teamwork are most important, and a good control on the roads, because we are going to deal with wild animals, can increase chance of the success ratio in these operations. A good what was in the mind for my team, that was the protection of the human lives and rescuing the tigers without any injury of the lives and without any harmness of the tigers. Keeping all these minds in my successful operation was biggest rescue operation in Pakistan. And during this operation, what was I used? That was the ketamine and midromidine. Again, the ratio. Next slide, please. I'm gonna share with you what was the ratio of KM I have used. It was 3 mg per kg ketamine and 0.05 mg per kg midromidine. Yes, there are some complications because the animal was hyperactive and was off it from more than 2 days, and he was already in a stress. Therefore, we see some bradycardia, which was controlled with the injection of atropine, and the anesthesia was more prolonged because I have used a high concentration of 0.05 mg per kg of midromidine. That was the reason behind to complete sedation of the animal, so that we can approach his in you can say that in wild area. The orchard of the orange. The orchard of the orange was more than a 5 to 50 acre. Thank you very much, everyone. If you have any question, you can ask for me.
So
let's talk about the recovery. I'm sorry, I just finished this slide.
Doctor, I work also in the wildlife zoo. Okay, so you have to careful with the back area, like a flank. You using like the back hind leg, because there's a sciatic nerve is also running there. Okay, I usually go on the back side most of the time. That's much
Right, sir.
safer.
I agree with you, sir. But again, the forelimbs have their own complications, like sir, whenever the walking animal, then needle can be injected in the neck region, or in you can say that it's closer to the heart. So that's why I always prefer the hind quarter.
No, that's good. That's okay. That's okay. Okay, you have
So
any
it's a
question for the
recovery
student?
science we can use, sir.
You have any question for the student?
No, I don't have, sir.
Okay.
Dr. Amir, would you please complete your recovery? The topic, I think.
Yeah, he completed the topic. Okay.
Okay. Thank you.
So let's do, if they have any question concern with the with the speaker, like I think I have one question in the chat room. Somebody asked me that when we do the surgery, there's a lot of blood. We can filter the blood and could give to the dog. I don't think so. There's a right thing, because we never want to use that one drug. That blood due to the cancer is highly contagious, and we don't want to take any chance. Okay, if I need to give the blood, there's a blood available in USA. We have blood bank also. We can easily get the blood. Plus, I have greyhound donor also for my hospital. They are available, like whenever we call, they are available. We scan, we make the availability, and also we check their pre-op blood work, make sure they are free with any disease, anything, and they are donor. They are very special. We use greyhound is a universal donor. First time there's no any reaction, anything, and we get the fresh blood. And most of the time it does not need, because the way we using the technique, the blood vessel sealer, laser, everything, animal is very comfortable, very recovery, and you'll see within 2 hours they start eating food. So I don't think so that's good idea, and I never recommend this one. Anyone has any other question?
Thank you, Dr. Ajaz. Can I say something if you allow?
Yes.
So I actually went through all the chat and I wrote down all the questions just to not have the chaos at the end when people are unmuting themselves automatically and the speakers can get disturbed and the aura of the conference can also get disturbed. So I found some questions. Like just 4 of them were from the FIP question. So if you allow, can I answer them now?
Yeah, sure.
Definitely. So the first question was the nucleoside analogs and protease inhibitors, can we use them? So yes, of course. Like the one Dr. Ajaz mentioned and the one that I also mentioned, the GS441524 is actually a nucleoside analog. So yes, you can use it. We just didn't give you the specificity, but it is the one. And for protease inhibitors, yes, there is another drug that is called GC376, which is also one of the experimental drugs. But yes, what it does different from the nucleoside is that the GS44154, it inhabits the replication of the feline infectious peritonitis virus, the mutated form. But the GC376, it inhabits the virus protease enzyme instead, which also helps in the replication. But yes, the you can say the potency, or you can say it is not as good as the nucleoside, which is GS441524. And one more question was there, which is related to this one, which I would like to keep Dr. Ajaz Rashid on the panel because he has been using that. It was that the oral one is more effective than the one that I have been using, which is the subcutaneous one. So what I thought, or what my mind says, is that it is because of the absorption level. The doses are well calculated. The stress level is less because we are giving orally. And what I think is that it could also be because the experiment have been done for many years now, and they have created this very good tablet with a good potency that can give you good results. So if Dr. Ajaz could put his insight into this topic as well. Dr. Ajaz, can you hear me?
Yeah, I hear
Yes,
you.
yes. Can you please tell that why oral one is more potent than the injectable one in FIP cases, the GS 441524, because you have used it. So they are
Yeah.
asking why.
No, no. As I told you that we are using both injection
Yeah.
and the oral one. There's no difference. Injection one is also working very good. We see the recovery. Completely, we see the recovery. And the oral one is also, we see the complete recovery. So I don't see any difference, anything. It's the preference of the owner, okay? Because sometimes the owner cannot give the injection daily, or they have to need to come back to the hospital, okay? So we don't recommend like, it depends on the owner, whatever they want. They want an injection. Injection one is also a little bit expensive, and the oral one is also a little bit cheaper. The way the treatment is, both are same. We check like after 7 to 10 days, we see, especially with the wet form, we see a very good success rate. Okay, very good success rate.
Yes. And there is another question, if I may ask, because they asked it in the comment section. That was like other viral diseases, can we inject the serum like we use for parvovirus or like the panleukopenia virus, we say? So for me, if I answer it, it is not very effective, because how do we get that? How do we get the serum? We get it from either the recovered animals, or we get it from the animals that have been that have the most antibodies, or the titers have been done. So practically, I would say that FIP is basically the mutation of COVID virus. And what does, it is the virus is also immune mediated virus. So when you will introduce more antibodies inside, the virus will have more potency to evade the region, and it will help in the FIP pathogenesis. So yes, it is not very potent. I have never used it. So if Dr. Ajaz, if you have used the FIP serum, you could, if you could tell that, because I have never used it myself, never heard of it as well.
So for the parvo, as concerned with the parvo, we have the injection available.
Yes, for FIP actually, for FIP specifically.
Yeah. So with the FIP?
Yes, they want to know about FIP, that do you have for that? So I told no, I never used it.
We don't have anything.
Yes,
we have for the parvo injection available. Is very effective. We give only one injection, okay? What is expensive? We got like a 6 injection, $1,300. And for the one patient, we charge for the client like a $650. Because our cost is like almost like a $200. So it's very expensive, but we see a very good result. One injection in parvo. Parvo is also very fatal disease. And very next day, doesn't need any hospitalization, nothing. Same thing with the pancreatitis right now. We have injection available. We give like a 3 days injection. That doesn't need any hospitalization, anything, okay? So right now, veterinary medicine is also coming like a very advanced, hopefully in Pakistan also. But although they are very expensive medicine right now, I don't know.
Yes, definitely.
People,
Thank you so much, sir. I just didn't want anybody to go answerless. This is why I just checked all the chat related to my topic. And there was just one question. Should we do the genetic testing? So you already actually answered it. So I just want them to remember that genetic testing cannot be done, because like Dr. Ajaz said, most of the cats will have the ferine coronavirus. And this is the mutated form. So it is not very reliable to check it. So yes, this is all from me. And I actually requested them to give me more questions, but nothing came up. So this is all from me. Thank you so much. Over to you.
Okay. Well, the last thing that we have, like my teacher, Professor Dr. Mazhar Iqbal Sahab, very respectful. I see the beginning of the conference and end of the conference. Sir is still here. I really appreciate. Over to Dr. Professor Dr. Mazhar Iqbal. Say something last word. We want to close the conference then.
Oh, thank you very much. You can hear me?
Yeah, we can hear you, sir. That's your closing mark.
Thank you very much. It was a very good conference, and I really got very good information from this conference. The only comment I will like to have is that in future, please ask the speakers to stick to the allotted time. It really becomes sometimes very disturbing when a speaker takes more time than required. According to the schedule, it should have finished by 9:50. it is almost now 11 in Pakistan. According to the schedule you gave us,
Yes.
the conference should have finished by 9:15.
Next
It is
time
11 now.
next time, sir, we
Yeah.
will stick on the time and
Yes.
with the timer, and that's it. No extra
Yeah.
talk, only for that one. Okay, that's it.
Yeah, that's actually, this is also a discipline,
No, you are right, sir. Before you have some objection, this time, if you look all the conference, I give like a 15-minute every speaker.
Yeah.
Yeah, only I
No,
think,
no, some speakers have taken more than even 30 minutes.
No, sir. No, sir. I have a timer.
But anyway, it was a very good conference, very good, very informative.
No, thank you, sir.
Especially from the
Your
wildlife.
remarks is very good, and we always keep your suggestion and recommendations up.
And I have a great respect for you, and I really appreciate the honor you always give me. That's really great of you, greatness. Your greatness that you love me and you give me the honor.
No,
Thank you
sir,
very
not me. Only everything. All in the conference, the sitting, they all your students. Okay, most of them. I think that 85 to 95% they are students. We all your student, and we love to have you in conference. And you are so sincere, and believe me, you are working just like the professor I see in USA, without anything. They're working on Sunday also with the student. Take them. We do like 100 and 150 surgery. They're standing with the student. Teach them without anything, okay? Because Sunday they are day off, but still they are working with the student. They give the help to the student. And sir, we feel like so proud and feel like very happy. You have you in conference, and you are sitting like a 4 hour or something like more than at this age. I think salute to you, doc.
Thank you so much. Thank you so much. Thank you.
Anyone have any remarks, anything, and we want to close the conference. Thank you. Thank you, everyone.
Thank you so much, sir. Maybe we didn't know, but
So
Dr.
we have
Mazhar
reached
Khan stayed in the conference from the start to end as well. He is the principal of the Rifa College of Veterinary Sciences, and he was listening to us, appreciating us, sending us messages, and we are also thankful to him as well.
Yes. Okay, I think hopefully we're going to close our conference. And
Yes,
thank you very
sir.
much. I
Thank
think
you.
it will take a long time to download this conference, look like 4 hours or something like. Okay, thank you, everyone. Thank you. You have a wonderful day.
Thank you, sir. Thank you, Mazhar, sir. Thank you.
Thank you, everyone. Okay, bye. Allah Hafiz. Allah Hafiz. There's one person they want to raise your hand. Farouk and
Sir, I have a question to send all the PDF. I mean all the PDF. Can you
yeah.
send?
You will see on the website. The Miraj, I think you will share your website. You will see the conference on the website. Okay. I'm download right now, and you will see all the presentation. Okay.
Okay, sir. Thank you, sir.
Okay. Thank you. Thank you. Thank you. I want to closing the conference right now. Thank you, everyone. Okay. Okay. Allah Hafiz. Allah.